y'all so much for coming, and I'm sorry we're getting a late start. It's like somebody said, it's President's Day, and it's also Monday, and I'm sorry we're getting a late start. And first on our meeting notices today is Department of Health, Behavioral Health and Developmental Disabilities. Dr. Shep, welcome, and we'll let you go first.
$4 million and total funds of 94.2. This is the 2012 budget year, just for clarity. And in this shows an accounting adjustment to change our DBHDD budgets to reflect a change in the employees' retirement system, $32,462, and total funds of the same. In 15.1.2, this line reclassifies other funds as federal funds in accordance with the State Accounting Office and the financial management policies and procedures. There's no effect on budget. This is simply moving things from a general class of other to federal. The accounting adjustment to transfers $20.1 million in TANF funding from other to federal and has no impact. So the net budget for addictive diseases is, as you see at the bottom, 43.4 and 94.2 total. In line 15.2, we have the adult developmental disability services, and beginning with 15.2.1, you see an adjustment to reflect a change in the employee's retirement system of $730,000 in state funds and total funds. The 15.2.2, this is to realize efficiencies of serving fewer consumers and institutions, and reflects savings from the closure of one state hospital. And this is from direct care funds of about well, what you'll see later in direct care is a similar figure, but this reflects about $2.3 million in savings to budget. 15.2.3 is reclassifying other funds as federal funds, again with the accordance with the State Accounting Office. No real change in to budget. 15.2.4, this annualizes the cost of the FY 150 waiver slots for the new options waiver and the comp waivers for the developmentally disabled to meet the requirements of our agreement with the Justice Department. This is roughly $7 million. The 15.2.5 line provides funding for 400 family supports, 5 crisis respite homes, 6 mobile crisis teams to serve the developmentally disabled consumers in the community settings, meeting our requirements with our agreement with the Justice Department, and the total here is 12.8.
I got a question. If it's all right with you, we're going to ask questions on the way.
Absolutely.
We might forget them. These crisis support teams, when will they be in place? When will these things be in place?
The
funding for 400 family support, 5 respite homes. When will we have those up operating?
These will be operating by May the 1st.
May the 1st. Are any of them in the Milledgeville district?
Yeah. Yes. We have 1 per region.
So you'll have a respite count, 1 per region in May?
Yes, that's correct.
Okay, what about your mobile crisis teams? Will they be in each region or just in the regions where the hospitals are closed?
No, they'll be in each region.
Will one cover it?
Well, we will be increasing them over time, but our agreement calls for one. This is targeted towards compliance with our agreement. These are the minimum requirements to be in compliance with our agreement with the Justice Department. Certainly more mobile crisis would be helpful.
Well, we have six regions,
We do have 6.
and so you'll just have a respite home in 5 of them?
We have,
Yeah, we're going to put a respite home in all 6 regions as well as a mobile crisis team.
mhm.
And we're going to increase them as we go across the fiscal years to get to 12 of each in each region, 2 in each region.
So you already have one right now.
We only have a kids crisis respite in Metro, but we'll have two up and running by May 1st, 2 of them, and then we're procuring for the others for regions 4, 5, and 1.
4, 5, and 1, but you're asking for 5.
That's correct. There's going to be region 2 is the Millersville area, will account for 1. Then we have in region 6.
Do you have one in Milledgeville now?
No, that will be up May 1st.
Okay. I just wasn't counting. You know, you've asked for 5, and you just listed 3 areas.
Well, region 1, the one in region 2, there's going to be 2 in region 3 that's going to make up for 2 of them. Then region 2, and then region 1, and then region 6, and we'll have to get to 1 in region 5 and region 4. So there'll be a total of 6 when we're done.
Okay. Any questions?
Sorry. Do you really need the total amount of $12 million now then if these things don't even start till May?
Well, this is starting in May of
This year,
this year, so this is annualized for 12. These will be up and running and operational through that time.
So what is the cost per?
About $1.3 million per crisis respite home and about $500,000 for a mobile crisis team.
That looks like we've got more money there than we really need to do at 1.3.
Because you're going to have some already up and running in May.
But they're not coming till May. That means that you'll have those funds available since January.
Since
Does it have to be in the budget twice to annualize? Okay. Okay.
I'm not certain I understand the question.
We'll check on that. We'll go back to that later on after the meeting. Okay.
Okay.
I have 24.
Are you
Oh,
counting?
I'm sorry, I couldn't see.
Mhm.
Number 24.
Are you counting the DeKalb Mobile Crisis Unit as a functioning unit? How
No,
many?
that's an adult mental health. This is developmental disabilities. The mental health follows later.
Okay. How many other crisis units? I was interested in how many others you've got across the state that are either mental health or developmental. That's what I was a little bit confused about. DeKalb has one or more than one.
well, DeKalb has an adult mental health crisis stabilization unit, and they don't have a DD
Okay.
crisis respite home as of yet. It should be up and running by May 1st.
In addition to the DeKalb's crisis mobile unit, mental health, how many others are there in the state now that are mental health mobile units? Any?
Augusta and
Augusta, Fulton, and Region 1 in the northern part of the state.
mhm.
And you're projecting your cost on these new ones somewhat based on the ones that have been operating or not? How different will they be? I know it's a different population. I just didn't know whether it's really a different financial analysis.
Based upon the staff.
Yeah, it's based upon staffing projections which come from looking at those regions in population, numbers of calls, admissions. So they're not the same, but they're
Different
projections.
Different data mix.
Yeah, and depending on how many consumers, what kind of distances are involved. So it is different, but I don't believe the variance is great. I think the variance is relatively small, so the costs are somewhat comparable.
And in the existing mental health crisis units, for instance, in DeKalb, are they providing transport services allowable under the law for 1013s?
If the individual is voluntary, then they can be transported by the mental health provider. If they are not voluntary, currently only law enforcement can transport someone under a 1013.
And are you supportive or not? Have you been able to decide yet whether you're supportive of your new crisis units being able to transport involuntary patients?
Well, in principle, we would like the allowance for non-law enforcement transportation for individuals who can be safely transported by non-law enforcement mental health providers. And that is in one of our legislative proposals. So we certainly are in favor of that. Do I believe that will have a substantial impact initially? Probably not. But having the provision to allow for non-law enforcement will allow us to build over time the capabilities and the confidence to do more of that. There are some individuals, particularly the elderly, others that are, clearly obviously they're not involuntary in a willful way, but they are simply not competent to be voluntary and could be transported in something less than law enforcement.
Madam Chair, may I ask one other follow-up?
Yes, go ahead.
We looked at your contracts, and I was just trying, just conceptually, it would help me if I understood it, and you may want to refer to this as you go through the budget or not. You have grants to about 11 counties, about 5 cities, and about 26 different school boards. Is there any way to generalize those kind of contracts and grants and explain why the other 140 counties or the other 100 school districts aren't getting a grant?
For developmental disabilities
or for your whole budget?
Though, yeah, we're trying to kind of second guess what grants you're looking at in particular. Many of those grants, if they're to schools, are probably part of preventive services. So these would be efforts at discouraging drug use and underage drinking and basically substance abuse in the teenage and younger population.
I was guessing that, and I was also going to guess, tell me if I'm wrong, that that's federal addiction money?
Yes. Much of the addictive disease money is federal.
And then the county grants would be, or the city grants may or may not be similar?
Most likely they would be.
And then the nonprofit grants, there are a lot of nonprofit grants that contracts that are relatively small dollars. Do you think most of those are addictive disease prevention monies or service monies?
Well, we're just, as you said, we're just speculating. We could get back to you with a breakdown of which grants go to what kinds of programs, in each of those areas, because we do administer a number of appropriations across the state. Some very small, some much larger.
I think that we've got some general information about that. I don't know that that you need to do much more work on that. I was just trying to, I want to confirm that most of that is federal addiction money. And you think it is?
I believe it is, especially if they're to schools. That's almost our exclusive contribution to schools.
Representative Murphy. That one. Uh,
I've got one.
Representative Manning.
Okay. I'll go next. Follow up on Mary Margaret.
Mhm.
So is the DD money, you've got a total of 400 slots, is that right?
A total of, these are, probably slots is a little misleading in this case. These are family supports, and family supports are very unique to the individual, and there is a great deal of variance. And so these are really appropriations specifically to meet a unique need to allow someone to stay in their family's home or their other residence. We think in terms of slots more around the comp waivers, which are more comprehensive.
Okay. At 15.2.5, you've got 400 family ones.
Mm-hmm.
And those are the ones you've been talking with Mary Margaret about.
Right.
Then I'm looking at 15.24 and then 15.27 on the new waiver slots,
Mm-hmm.
and we've got a total of 4. That means 400 different services, not 400 different people, right?
Well, it actually
Just
means
help out.
400 different families with, there's about roughly a dozen or so kinds of services that can be provided under the now waivers. These are non-conventional kinds of services that help to allow someone with developmental disabilities to stay within their family. Do you have some examples, Beverly, off the top of your head?
Of the family supports,
Mm-hmm.
The now conflict.
Fam-
of the 400 waivers.
of the family supports, the kinds of supports that are in those waivers.
Family, actually, there's discrete services like community access, day support services, residential services. There are services for them to have supported employment and community living support where someone goes into the home and provides.
I'm just trying to figure out how many people we're serving.
If you're talking about under family supports themselves,
15.24
15.24.
and 15.27, because we are adding additional 250.
Oh,
I'm
okay.
just hoping we're getting new
Fi-
folks,
15
not folks
point-
that are already
right,
being
fif-
served.
Mm-hmm.
So these are all new,
Yes, ma'am.
and the 150 are old ones that are just being renamed. Is that right?
No, this is very easy to get sideways on. Let me back up, because 15.2.5 are family supports. Those are 400 individuals, 400 new individuals receiving an array of different kinds of services to stay where they're at, but they're 400 new. On 15.2.7, you're now talking about 250 waiver slots that are a combination of 150 for people transitioning out of facilities into the community and 100 for new people who have not yet gone into a facility to prevent them from going into a facility, to allow them to go directly into community support. But all 250 are new individuals.
So how many are left on the waiting list?
Well, within our facilities today, we have about 670 individuals in the facilities. And the waiting list is a slippery number. The number that you will hear most common is 6,000. I believe that the number could easily be twice that. What you have is a self-identification. People get on the waiting list by their own initiative. Their family or someone comes forward and requests services. At different points, people fall off the list because of just discouragement, that don't feel that anything's happening, so they don't bother to keep themselves active. But when there's motion in these waivers and people see things happening, then they come back on the waiver. So even though we may serve 500 or 1,000 people, a year later the number will still be 6,000 because more will have come out and got back on. It's kind of like unemployment figures. People stop trying after a while.
I've been around long enough to know that one.
Okay. Sorry for too much detail.
That's all right.
Representative Hurd.
Yes, thank you, Dr. Shipp. My question is in reference to the closing of a Rome facility. I understand there's some $8 billion, I don't know the exact number of capital improvements and things that are going on at that facility. What's going to happen with that?
Well, I'm not certain what that figure is. I'm sure it's south of $8 billion, but that property ultimately will belong to the State Properties Commission. And right now, the governor's office has engaged both the Department of Labor and others to assess what the best use of that property might be, if you're talking about the physical plant.
Yeah, exactly.
So at some point, there are many options, and the community is engaged in conversations about what would be the best use for that.
I have a question. We were talking about the waiting list. Now, children that are in foster care and they're getting ready to come out of foster care, do we have slots for them on the waiting list, or what will happen to these kids?
We do stay in close contact with DHS about children in foster care with developmental disabilities as they age to adulthood. We do retain in reserve funding to meet their needs and provide for that transition.
Well, we've got a couple in the next 2 or 3 months that are aging out, and it's estimated that we've got 31 youths that are aging out in 2012. So you have made allowances for those 31 years. And you do have slots for those 31 years. So, because I would hate for them to be put in nursing homes or shelters. And some of the families have agreed, I think, maybe to keep them. But you do have slots for those 31 youths, and you have the money for them.
Some of the requests that we had for the 100,
What?
the 100 additional that's already in our ask, we're hoping to be able to use those for those 31 kids that are aging out. To keep them from going into institutions, because the only other place for them would be a nursing home.
So you're just asking for 100 slots and 31. Well, we've got 100 that are aging out in 2012. So that's reserved just for foster kids?
No.
Many of them, some of them may end up on the planning list for services. But what we try to do is put it in the ask for that 100 to use for the 31 that are coming out immediately, and then try to project for the rest of the year, possibly through attrition or additional funding requests.
No. What we're saying is that of the DFACs, the children in foster care, they represent a third of that 100 requests.
Well, we've got 100 coming out in 2012.
31 of which are the DFACs that you've referred to. The children in foster care are a portion of that 100 that is coming out.
Oh, I thought we had 100 children in foster care that were aging out in 12. Maybe
No.
my reports are different from y'all's.
No,
The number that I'm familiar with is 31.
Well, 31's coming out in the next few months. But the total year, it's 100, isn't it?
By the end of FY12.
Would you please step to the microphone and because so we can.
I'm Beverly Rollins. I'm the Executive Director of the Division of Developmental Disabilities. And the number that we're familiar with is 31 individuals who are aging out over the next few months of this calendar year. And as they age out, we intend to use the waivers that we will receive of the 100 to allow them to enter into our waiver. And I'm sure that there are more kids that are going to be aging out over the calendar year of 2012, and it's probably around 100. So what we hope to do is, with the additional funding, support those to keep them from going into nursing homes, and then as people attrition off the waiver, continue to use those to help fund them as they age out.
we have 100 in our 11 tasks.
Yes, we do.
See, part of the confusion is we have 100 waivers in our FY11 amended request. Those 100 will cover the 31 that we're talking about, and they will roll into the base of 012, which you're not seeing here because this is just the change. And in 012, this 100 will be available for those individuals that are aging out. The other thing to keep in mind is that across the calendar year, thinking of these as in an absolute way as a waiver is a little bit misleading because not everyone will come out on July the 1st. They will come out in proportion across the year. And so this funding will actually probably serve more than 100 unique individuals in the calendar year, but won't serve them all for the whole calendar year. And I see Chase nodding his head, so I can't be too far off on this.
Well, I think what I want to do is just to make absolutely sure that these children that were aging out of foster care were taken care of.
Mm-hmm. Absolutely.
And you're assuring me they'll all be taken care of with waivers that need them.
Yes.
Yes.
Okay. Go ahead. I'm sorry. Any other questions?
I'm so happy.
All right. Go ahead. Thank you.
All right. I think we were on 15.2.6, which is FMAP restoration. That reflects the ARA funds going away and our FMAP percentage going to 35% by the end of, throughout your fiscal year 12. So $42 million FMAP restoration. In 15.2.7, these are the 250 waivers of which we've just spoken, and they are roughly 7.5 million. In 15.3, we have adult forensic services. 15.3.1 is an increase in funds to reflect an adjustment in the employee retirement system. It's 52 million. No, the entire retirement fund system correction is just around $8,000. Accounting and that you'll see in all the other departments as well. In 15.4, mental health services. 15.4.1, this is that employee retirement system correction. It's $423,000 in mental health. In 15.4.2, this is to provide funding for mental health consumers in community settings to meet the requirements of the state settlement with the U.S. Department of Justice. This is the $32 million in fiscal year 12, and it reflects an array of services from assertive community treatment teams, community support teams, intensive and general case and regular case management, crisis stabilization units and community hospital beds, modest increase to our crisis line, supportive housing and supportive employment support, peer support services, and some training, quality management, and housing supports, and some of our ongoing legal fees. In 15.4.3, this is an FMAP restoration of $8.1 million, again with the FMAP going to 35% in 012.
Question. If we didn't replace all those funds, what would happen?
Well, then our budget would be short by about $8 million.
I said if we didn't replace all of them, how much could you get by with?
The budget is built on getting the FMAP restoration in place. I think if people would lose services, that would be, that would be taking money right off the top, basically.
Okay, I just, we're just curious. We're trying to.
Mm-hmm.
Okay.
Yeah, the FMAP restoration. I would also make the point these are dollars that are matched by federal dollars. So
okay.
Every dollar that would come out of here would result in a threefold loss.
Okay.
As well. So we'd be tripling
All right.
the damage.
All right. Go ahead. Is it 70-30 match?
It's moving to 35%, so 65-35.
Okay.
So it's about a 2-for-1 match. So any dollar coming out would really be $3 coming out.
Okay.
In 15.5 is the adult nursing home services, and 15.5.1 is an increase in funds for the employee retirement system, $65,000, $66,000. 15.6, child and adolescent addictive disease services. The total budget there is at $3 million state funds and a total of $14 million, which reflects the substantial federal funding to these programs. And again, you have a modest $38,000 reflecting the employee retirement system correction. 15.7 is child and adolescent developmental disabilities, 8.5 million and 11.4 million reflecting federal support. And the employee retirement system correction is about 54,000. And 15.7.2 is a one-time reduction to the Marcus Institute of $235,000.
Representative Manning.
How much is left in Marcus?
How much is left in Marcus?
Yeah. 5 million.
You mean in our budget?
In the contract for the Marcus Institute for autism. How many?
We're thinking 4.2.
So is this their 4%?
This, if it's
4.8, yeah.
4.8 is the total. 4.8 is what would be left.
4 points. Okay.
Thank you.
Did you cut any other contracts or just markers?
That is the only one that is a line item in this budget document.
But other contracts were cut.
Well, the hospital, I mean, in terms of external contracts with...
I had a list of your external contracts and had some questions about some of them, and be glad to go over. And I was wondering if any of those were cut, if you just zeroed in on markers.
I think this is the this was the recommended budget.
Would you like to go to the...
Representative Hudson, the money that's being reduced from the Marcus Center contract was because it was one-time money, a one-time line item appropriation, and for last year, and so it didn't roll over, and so we didn't initiate the cut for that contract.
It was left over? Marcus left?
No, it was only in the budget last year. It said it was one-time funding for them for that year, and it didn't roll back into our appropriation this year.
All right, like the Mary Hayes Center for Social Change, that contract, are you familiar with that contract?
No, ma'am, I'm not.
It was listed as one of your contracts.
Is that one of yours?
Reverend Rock Sims.
Is that one of yours? A prevention contract? Is it?
Prevention contract.
Prevention contract. Okay. What about Learn to Grow? 2 contracts, $271,000.
Prevention.
It's prevention. That's all federal funds. There's substance abuse prevention and treatment block grant funds.
Learn to Grow. No state money was in that.
Right, just federal.
So all these other contracts, Friends with Jesus.
Are they prevention? Is that a prevention one as well?
It's prevention.
Yes, it's a prevention contract as well.
We have approximately 130 prevention contracts, and they're all funded with federal funds.
Okay, we couldn't tell from the list you gave us for contracts. You just had the amount listed. You didn't have it broken down whether state funds or federal funds. So we have really no way of knowing what is going in state funds because it was not broken down in state and federal.
We can provide that for you.
And we'd like it broken down in state and federal so we can see whether these state funds. When you talk about these federal funds, do y'all oversee and see how many children? Do y'all oversee these funds or just?
Yes, ma'am, we do. We actually do an accounting and the one-time application to SAMHSA that has to be approved by the SAMHSA administrator, and that includes very significant data collection on each of these contracts and services.
So the Marcus is the only contracts you have that has state funds going to it.
No, ma'am, it's not.
Okay. Thank you.
Mm-hmm.
Any other Representative Manning?
So when you administer these prevention contracts outside of the department, do you get a fee for those contracts? An admin fee or something? Of the 15% that you're
In the federal grants?
in the prevention contracts, the 130 that you just lapsed?
They didn't lapse.
No.
They didn't lapse. Well, how? I guess I need to see the list and how they roll. Do they don't lapse? They just keep on rolling, even though the federal funds are.
Well, I mean they are applied for and they're administered through SAMHSA, and
Administered through what?
through the Substance Abuse and Mental Health Administration in Washington. It's the agency that provides this funding.
Do you get an administration fee when you apply? Or does it go to the behavioral health, or what is the admin fee?
Actually, the entire block grant is approximately $53 million. There's a 20% set aside for prevention that must be met, which is approximately $10 to $12 million, depending on the grant award. We can only spend 5% of that total $53 million towards the administration of that block grant. There is a very significant caps and things that must be met for that block grant. And again, we do an annual application that starts in October and it goes through several layers of approval through SAMHSA.
This is 5% fee.
Yes, ma'am. And we actually spend less than 5% on administration through our block grant, put most of the funds towards services.
So how much do we spend?
I believe it's between 3 to 4%. We can get you the exact figures on that. And we have our block grant pamphlet that we do our hearing each year. We can provide you a copy of that block grant pamphlet that shows you exactly how much we spend in treatment, prevention, and administration for that block grant.
So you retain the other 2% you don't use?
No, ma'am. No, ma'am. It goes towards services. We spend it in our service areas instead. We put it towards treatment.
So every dollar of the $53 million goes toward treatment.
No, the $53 million, 20% goes towards prevention, substance abuse prevention. The rest towards treatment. The small percentage towards administration, and then we also have a different set asides. We must spend a certain percentage towards HIV services for the state of Georgia. But I can get you a copy of everything.
Okay. So I need, Madam Chair, thank you.
Thank you. Okay. Any other questions? Go ahead. Okay.
I'm sorry, what was that young woman saying?
That's Cassandra Price.
Cassandra Price. I'm sorry, Cassandra.
right.
I should have introduced you. I'm
I should
sorry.
introduce myself. I got talking too fast.
Thank you. Representative Murphy.
Thank you, Madam Chairman. I would just like to ask if we could get a copy of those contracts that are provided for substance abuse. One of the federal contracts that you administer, please. All right. Thank you. Thank you, Madam Chairman.
All right.
All right.
I think we're at 15.8, Child and Adolescent Forensic Services. The budget is at $3 million. And we have the Employee Retirement System correction of 16,900. And 15.9, Child and Adolescent Mental Health Services. 15.9.1, this is the Employee Retirement System correction of about $230,000. In 15.9.2, this is a transfer of state funds related to the transition of child and adolescent programs to community settings from our direct care support services program to child and adolescent mental health services program to properly align our expenditures with budget. This is funds transferred from direct care and support services, and these dollars are used in, these dollars came from the child and adolescent units that were closed at the regional hospital in Atlanta and at Central State Hospital in Milledgeville. And these funds have been redirected to children and adolescent community program. 15.9.3 replaces the FMAP in this area, and it is at $3.7 million for FMAP restoration. 15.10 is departmental administration. 15.10.1 is the employee retirement system correction of $127,000. 15.10.2 is an adjustment to the workers' compensation premium. This is a reduction of $140,000. 15.10.3 is this reflects an adjustment in our telecommunications expenses. These reflect gate costs, $577,000. 15.10.4, this is a reclassification of other funds to federal. Again, this is an accounting move that transfers about 7.3 from the other category to federal to more correctly identify their source. There's no impact on budget. 15.10.5 is a transfer of state funds related to software licensing. This is $555,000. This is only desktop licenses. In 15.11, direct care and support services, 15.11.1 is the employee retirement system correction of $821,000. 15.11.2 is a transfer of state funds from child and adolescent programs to community settings from direct care and support. This is $3.5 million. 15.11.3 is the direct care program savings related to closing one facility, and that's 3.3 million. The total savings from direct care and support and from the other hospital portion come to about 6 million. 15.12 is a substance abuse prevention, and the only item here is the employee retirement system adjustment, $43,000. 15.13, this is the attached agency, which I believe you'll hear a report from separately later this afternoon, as well as 15.14, which is the Sexual Offender Review Board, also an attached agency that will report separately. And I believe that concludes the 2012 budget request.
Any further questions? Representative Hurd.
Yes, thank you. Dr. Shipp, I noticed you have in the 2012 budget 7,181 positions. Do you anticipate any more positions, bringing on any more staff or anything at this time?
We have a few. We still have some open positions in our hospitals that we're moving to fill in alignment with our CRIPA settlement. We are hoping that we'll be able to transfer some positions from the Rome facility. Net by the end of 2012 will probably most definitely show a reduction in total positions.
So these will be in the field positions, any admin positions that you're going to be adding?
We still have a few important positions internally.
And what positions would those be?
Well, we have some in finance and operations.
How much money are we talking about with those positions?
Boy, I would hesitate to put a number out and have it be too much variance. I could get back to you with some
If you
detail.
could get
I'm
back
thinking
with me, the position
probably
and the salaries.
yeah. Okay.
Thank you.
Representative Oliver.
I think Representative Kidd told me that y'all had been able to give jobs to over 80% of the folks that had jobs in Milledgeville. Is that about accurate in your assessment?
It sounds a little high. We did manage to find quite a few because there were shortages in staff. The hospitals have been very short-staffed across the board, so many folks were able to reposition within the other areas of the facility.
And what planning have you already initiated to assist the employees at Rome? How many employees are there at the Rome Hospital?
About 784.
And what have you already started to do to assist those 780 employees find new jobs?
Well, we had a job fair on Friday last week. We have made available all the open positions across the state, and we've had inquiries from particularly much of the professional staff, the licensed staff, and then some of the private providers that will be bringing up some of the services in the community have also been part of our job fair initiatives, both for the ACT teams, the Crisis Stabilization Unit, and many of the other community-based services. So we've been working in partnership with the private providers to also make those positions known.
In addition to the transitioning of that property and the ongoing expenditure of the bonds, I think that we as a committee are going to continue to be asking, these questions in May and June and throughout the summer. Just if you're as successful as you might have been in Milledgeville, is it likely y'all be as successful in Rome in helping employees find? We'll be following that, and I'm sure you'll be updating that for us.
Yes, we will.
Representative Manning.
Shep, do you think that the Children and Adolescent Services, mental health and substance abuse and other services for those children are going to be taken care of for the next year based on this budget?
Do I think that the children and adolescents' mental health and substance abuse needs will be cared for by this budget? Children and adolescent services in our budget are largely DFACs, those in state custody. We represent one of 5 payer sources for the poorest, most vulnerable children and adolescents in Georgia. Most children and adolescents are under Medicaid, and they receive services from each of the 3 CMOs, and then some through our services. And then there are other agencies that also have children and adolescent services, juvenile justice, education, and others. So it's a difficult question. I can say that we do feel confident that what's appropriated here will be used to its maximum benefit.
So the answer is maybe.
I would move it to a maybe plus or a probably minus.
Thank you.
Thank you. Are there any other questions? Thank you, and thank you for coming.
Thank you.
Hey, how are you? Is the microphone at the table working? Yeah. Is it okay to sit at the table? Okay, thank you. Okay, thank you.
Thank you, Commissioner Bruce. We're running a little behind schedule, so maybe we'll catch up on you.
Good morning. Thank you, Madam Chairman. Appreciate the opportunity to come before you again. Today we're going to be talking about fiscal year 12 budget recommendations for the Department of Human Services. You've heard me talk with joint appropriation and at your fiscal year 11 amended about where we are as an agency with our budget and where we are with the things that we must do and what those are. And you've heard me talk about the TANF, maintenance of effort, and the importance of that to the agency's budget. So I'm going to dispense with all that today, and in the interest of time, just go straight to the numbers and the programs for fiscal year 12. So we're going to start, I'm using a PowerPoint, and I'm going to, this will track your tracking sheet. So we're going to start with adoption services, which on your sheet is 27.1. And we start out for 12 with a budget of $31.2 million. You'll see in all of these program categories two things that will be consistent throughout. Something called statewide deductions. These are things like unemployment insurance, things that OPB has booked in as expenses, workers' comp expenses, telecommunications expenses, employee retirement system. These will be consistent throughout as a line item. Then you'll see pretty regularly, and I'll mention it most of the time, a replacement of R funds by OPB to fill the hole in the budget that the loss of those funds will represent. Then you'll see something called other reductions, and those are things with contracts, and also always a movement of unemployment insurance redistribution of funds from our administrative budget for programs. So I won't go into that detail on those items for every program, but you'll see those consistently throughout. So for adoption services, we start out with $31.25 million. We end up with the governor's recommendation of $34.23 million in state funds, and this is largely reflective of the replacement of the R funds. I'll move to 27.2. This is after school care. You'll see that we are zeroing out state dollars in this program and replacing totally with federal funds. This is all federal fund program. 27.3.
Can I ask you something? In this
Yes.
after-school program, now, do you contract with different counties to run these after-school programs?
I have some folks behind me. I have a lot of staff here to help me answer questions. Is somebody going to help me with that one?
Good morning, I'm Cliff O'Connor from DFAX. The after-school program goes to a variety of providers. The biggest contractor is the Boys and Girls Club. We also contract with the YMCA. We put the funds out through an RFP process. Some of the winners are school districts, so it's really a mix of community-based organizations and some school districts who've been able to come up with a match. One of the big things that we do with this program budget, we issued the $14 million. The people who want to get that money have to both compete for the money, but they also have to come up with their own local funds to match the TANF money. So we're currently generating $28 million in TANF maintenance of effort for the $14 million in TANF funds being issued.
Thank you.
All right. We'll move to 27.3. This is child care licensing. We started out in 12 with a budget of $343,200. We're totally zeroing out state funds in this program to replace with 100% TANF money. So you end up with zero state dollars in child care licensing. 27.4, child care services.
Wait.
Yes.
Representative Oliver has a question.
We anticipate a plan coming forward this week that's going to reduce the number of hours Hope will pay for pre-K. Is there a discussion going on about whether, if it's reduced for all those providers out there, I'm trying to figure out how those providers for low-income children are going to make up that gap. Are there any discussions going on as to whether or not any of this after-school money can be shifted, moved, or realigned to help with the gaps in the pre-K program? Is anybody talking about that?
If there are, I haven't been privy to them. I haven't heard about that yet. No one has broached that subject to me yet.
It's something that I'm worried about, that I'm sure more people are worried about than me. That if you're going to reduce, in essence, the HOPE grant to all those child care providers out there by 10 to 20%, where are they going to be asked to make up the money totally, or is there going to be any kind of shared burden of that from the federal TANF monies? And somebody will be able to answer that for me this week, probably.
Okay. Well, I can certainly ask about it myself. I haven't heard anything about it today. So child care licensing, which is 27.3 on your tracking sheet, that's going to zero out all state dollars. We move to 27.4. This is child care services. This starts out with a budget of $54.262 million, and that remains the same. There's no reduction in this amount. You recall it was the same for fiscal year 11 amended. There was a R maintenance requirement to keep this figure the same. I think we would have been susceptible to losing about $82 million in R funds if we had not maintained this figure. So the governor's recommendation is to keep it at the $54.262. Next, we move to 27.5. This is child support services. We start out with the budget of a little over $20 million. With the reductions and the other things that I talked about earlier, plus a replacement of the loss of R funds to the tune of $5.1 million, we end up with a recommended budget figure of $24.5 million in child support services. Next, we move to child welfare services. This is essentially, a lot of this is DFAX money. We started out with a budget of $89.41 million. We have our statewide reductions, and we had some contract reductions in this area, and we end up with a recommended figure of $89.587 million for fiscal year 12. We'll move to next category on your tracking sheet is 27.7. This is child welfare services special project. There are zero state dollars in this program. This is 100% TANF money, and there's $250,000 for fiscal year 12. Next, we move
Uh,
to,
we have a question.
Okay.
Representative Manning.
What kinds of special projects are that? Can you enlighten me a little bit on?
yes, I think there's someone here who can help me answer that.
This special project goes out to the child advocacy centers around the state, and I think the origin is that in the past there's been times when they've received funding both from DFACS and the Governor's Office of Children and Families. And my understanding is that the legislature put this in as a special project in fiscal year 11 and 12 because they wanted to make sure that they got the funds. So it's really all going out to the child advocacy centers, which I think there's like 44 across the state.
Do you administer that fund?
Yes, ma'am.
Do you have a list of what centers there are?
Yeah.
Because there are 159 counties.
Correct. They don't cover every county. They're by judicial districts. There's usually one per judicial district. Sometimes there's two per judicial district. But we can certainly provide you with a list if you're interested.
I am. Thank you very much.
All righty. We'll move to line item 27.8. This is community services. There are 0 state dollars in this program. There are approximately 17.1 million federal dollars, and this is community service block grant money. 27.9, departmental administration budget. We start out with a figure of $37.1 million for 12 after other reductions. This is a category in where we have $3 million or a little more. We transferred with regard to the healthcare reorganization to the Department of Community Health and to Dr. Shelp's department with the reorg that took place in 2009. We've got the other categories that I mentioned previously, and so this administration figure is reduced for 12 to $33.499 million. And if you recall, I've testified previously that unlike many agencies, this administrative budget includes some what I call direct services money that inflate this figure by about 20%. For example, there's client transportation services included here. There's mailing costs for food stamp caseloads included here. There's EBT processing fees for food stamps here. There's facility rentals, food stamp fraud investigations. All of these things are included in the Human Services Administration budget, but we have a reduction for 12 recommended to go down to $33.499 million. Moving next to
Mr. Commissioner, thank you, Madam Chairman. Mr. Commissioner, based upon your replacement of state funds, did we allocate funds for the transportation of our elderly citizens someplace else?
Well, this category, this is not a total replacement. This is a reduction based on some telecommunication funds. So there's still going to be funding in this category for transportation services. I have here a figure included within this of $520,000. I think that's accurate, but this is not total elimination of dollars in this category for those services. I was just highlighting that
Okay.
those are the kind of things that are included in this amount.
Thank you. Thank you, Madam.
Next, we go to 27.10, elder abuse investigations and prevention. We started out with a budget of 11.749, and we end up with 11.882. Basic change here is the unemployment insurance funds redistribution. We move now to 27.11, elderly community living services. We started out with a budget of $55.77 million. We had a replacement of R funding to the tune of $11.4 million, which allows us the government recommendation for this program for 12 is $65.4 million. We did have some contract reductions that we talked about previously for the Center for the Visually Impaired, for Alzheimer's respite, and for the non-Medicaid waiver respite services. Those were offered up as reductions in this category, but we ended up with a net increase in this program to a figure of $65.4 million.
Thank you. Mr. Commissioner, 2711-4, eliminate the contract for the Center of the Visually Impaired. I know we talked about that previously. Can
Yes,
you,
sir.
how will this affect the clients? How many people are we talking about will be affected with this cut, or what's going to happen, I guess is my
Well,
question.
I'll let my staff behind me help me with the exact number of people. I think what we've said is that within the funding that the area agencies on aging will get in the social services block grant, they can try to make choices about moving money around if they want to put some money back in this category. But there's no question we tried to find cuts to come up to get to the 4%, 6%, and 8% figure we were required to do so by the Purdue administration, and this is one of those areas that ended up having a cut. I'll ask someone behind me to help me with the exact number of people. I don't know that number.
Hi, Dr. Bill, Innovation Services. Our contract with the Center for Visually Impaired is based on the types of services delivered to the client, so it's hard to come up with a number. I can tell you if an individual would receive low vision consultations, there'd be about 307 clients who wouldn't receive that service. If they were going to receive home-based rehabilitation and teaching, there's about 2,000 individuals who wouldn't be able to receive that service. And low vision aid, the other 2,000.
So we're looking at right about 4,370 people,
If all
roughly.
those funds we use for that one particular service.
So, correct. This is a very specialized area too, isn't it?
Yes.
Do we have others that have the capacity to handle this?
It's my understanding that the Center for Visually Impaired is one of only a few agencies in the state of Georgia that provides this service.
Right.
So Representative Hurd, this is an area where one of those where there's going to be feel the pain because of the budget cuts.
Now, let me ask you this. I've known some of the clients that have gotten help from this facility. It enables a lot of those individuals to stay independent, correct? To go work and make a living and do those things. That definitely helps us, helps the state, and it definitely helps them too. So I guess that's one of my concerns, is that those individuals that are seeking employment and are working, and if it was not for this facility, they would not be able to go to work and make a living.
That's duly noted.
Could you tell me the percentage of cuts that the elderly have had to take the last year in comparison to the other part of your budget?
I'm going to ask our CFO, Lynn Belinga, to help me with that.
It just seems like, we see more and more cuts in services for the elderly. Is that my imagination?
No, we've had cuts across all our organizations. You have to get back to 1%.
So you don't think elderly have taken a more cut than other parts of your
I might be inaccurate on that.
All right.
We've taken cuts across all of our organizations.
I know you've taken cuts, but percentage-wise is what I'm interested in. It just seems like percentage-wise that the elderly seem to have taken the worst cuts just looking at your budget like this.
We'll try to see if we can
All
quantify
right.
that.
Thank you.
All right.
I'm sorry, I did have a follow-up to that. Is there some federal match with that visually impaired funding? They don't leverage that?
They may through their organization. We don't have that part of their budget.
Okay.
This is just our contract we have with them.
So you would know whether or not they have any federal match? Okay. Thank you. I would appreciate if you could get that for me. Thank you.
All right, we'll move to 27.12. This is Elder Support Services. We start out with a budget here of $665,555 and end up with a recommendation for 12 of $666,656. Line item number 27.13, Energy Assistance. There are 0 state dollars in this program. These are all federal funds. Currently, there's about $28.6 million for the low-income home energy assistance. You may have seen over the weekend an article in the paper that the President's proposed budget cuts some money for this program for the nation, and this would affect Georgia, of course. We don't know what the ultimate resolution of that is going to be, but we will watch it closely for the committee. But currently now, there are $28.6 million and no state funds.
I'd like to see a printout of where these 28 million went by counties
Okay.
and the number of people they served.
All right. We'll try to get that for you. Next, we move to Family Violence Services, 27.14. The state budget starts out at $4.4 million. Recommendation at this point in time is to zero out state dollars and replace totally with TANF funds. There's been a lot of discussion about this area. You've heard me talk about whether or not, the question has been asked, whether or not TANF funds can be used for this purpose. We have said that we think it can be. We have talked to the governor about this, and the governor has said, particularly with regard to the funds within this figure for sexual assault centers, which is about $655,000. We are consulting with the federal government right now. We have asked specifically the question and asked for an express definitive answer as to whether or not they will consider the use of these funds for family violence and for sexual assault centers as a permissible use. They are looking at it and going to get back to me any day, I hope. What the governor has said is that if for some reason the federal government says that TANF funds cannot be used for the sexual assault centers, we will find the money to that $655 to put back as state dollars to keep this whole at the 4.4. We don't really have much of a concern. We feel we're pretty solid ground with regard to family violence services. Other states do it. We have done it in the past. Sexual assault centers is a new category for only TANF this year, and so we're seeking to get clarification on that, but the governor wanted to give some comfort level about that to those centers, so he has issued a letter to that effect.
Representative Manning.
Now, do I understand that, I mean, where is this 655 going to come from then? You got any idea?
We'll have to find it somewhere else in our budget.
Well, I don't know. I don't see it anywhere that I can see.
Well, I don't exactly know either, but we're going to have to dig
Are you
down
going
and
to
try
start printing
find it.
money?
Well, I don't know how we're going to do it. We're going to have to cover something else, and so something in here will change to account for that. We're hopeful that it doesn't come to that and we don't have to do it, that the federal government will tell us it's all right to use TANF money for it.
So would you say that by the time we get through in this budgetary process, which will be, what, in the next 10 days or so, that you'll have an answer?
I think we will, yes.
Okay, thank you.
All right.
Representative Murphy.
Thank you, Madam Chairman. To the Commissioner, thank you for the desire to try to identify some funds to replace the $655,000. I just want to ask you if you're able to find $655,000 to replace this, that you take a look at the monies for the visually impaired as well. I think $177,000 might be a little bit easier to find than $655,000.
Yes, sir.
Thank you.
Thank you. We move to 27.15, federal and unobligated balances. There are no state dollars in this program. There are no expenditures in this line item. This is a projected carryover of TANF money, and for 12, the projection is $14.395 million. 27.16, these are federal eligibility benefit services. These are our frontline Medicaid, TANF, food stamps eligibility workers. We started out with a budget of $93.258 million. We'll end up, because of the line items previously talked about, with a recommendation of $94.9 million in this category. We move next to federal fund transfers to other agencies, 27.17. These are funds that come into DHS, but then are transferred out to other agencies for allowable uses under federal law. There are 0 state dollars in the governor's recommendation, and total in this category of federal dollars is about $112.8 million.
Can you give us a list of where these monies were transferred to?
Yes, Representative, we can.
Thank you.
We'll get that for you. Next, we move to line item 27.18, out of home care. We start out with a recommendation, or we start out with a budget of $65.6 million. We end up with a recommendation of $60.632 million. We had a replacement of our funds of over $4 million here, and we offered up as a budget reduction over $9 million from this program. And as you've heard me previously say, we felt that we could do that because of a decrease in utilization of these type of dollars and these type of facilities due to effectiveness of the agency and permanency situations for children.
Could you please comment about the recent things that have happened to children in Georgia in the last 2 weeks, the deaths and what's going on and about that? And it's my understanding just from reading the paper that these had been referred to DFACS at one time.
Well, certainly there's been in the last 2 to 3 weeks some very tragic examples of deaths of children in different areas of the state. We have tried to look at it to determine what role the department had with any of these children and what we could have done differently, if anything. I'll say coming into this area new that I have said we want to take a very hard look and reevaluation of the practice of what's known as diversion, where there's some contact or evaluation or attempt to substantiate abuse or neglect, and the decision is made that not to bring that particular child or family into the state system. What I understand is once that decision has been made, there is no follow-up to determine what happens in that family with that child. And sometimes we end up 2 years later where you have a story like these you've seen in the paper in the last few weeks. Certainly the department is to be commended over the last few years for what it has done to reduce the amount of children in foster care to try to keep families together. We want to look at has the pendulum swung too far the other way. I don't know the answer to that, but we're going to take a hard look at it because any one child death is too many. But to the extent that diversion has played a role in that, we're going to reevaluate our use of it and the extent of it and how it's done.
Thank you. That makes me feel better.
Next, we move to category 27, or line item 27.19, refugee assistance. There are no state dollars in this category. The federal figure is $4.7 million. 27.20, support for needy families, basic assistance. There's $100,000 in state funds in this program. That is the governor's recommendation, and there's approximately $54.3 million in federal money in this category. Support for needy families, work assistance, line item 27.21. There are start out with a budget for 12 of $3.5 million. We end up with a figure of 0. We are reducing and all state dollars in this category will be only federal funds. One of the reasons being that there's been a decrease in utilization of this money, and so the governor's recommendation in this program for fiscal year 12 is 0 state dollars. I won't get into the budgets for the Council on Aging 27.22 and Family Connections Program 27.23, as I believe I understand they're going to be making their own presentations to you this morning. So with that concludes our fiscal year 12, and we'll be happy to answer any further questions that you have. I think my staff has helped me keep track of the questions you've asked and the list of things that you want, and we'll make sure to get that to you as expeditiously as possible.
Representative Oliver.
I'm
Wasn't your light on?
No, ma'am.
It was Judy, Representative Manning.
Yes, sir. I appreciate your candid comments on the budget, and I think you did an excellent job just being in the hot seat for a short amount of time.
Thank
And
you.
I thank you for your willingness to share with us on several issues. I'm concerned about the support for needy families, the work assistance there.
Mm-hmm.
You said it was due to a decrease in utilization. Have you got some data that backs that up?
Well, I think what I was referring to is the work assistance, and what I understand, and there's staff here who can help me answer more specifically, is that we've had some success in moving people in the TANF program into work, onto the work roles, and therefore the money used to assist them to get to that point, there's been a decrease in utilization of that particular category. So actually, in some respects, that's a good thing. So as you move people and they're actually working, this work assistance funding, we've said we can have a decrease because there's been a decrease in utilization. And that's what I'm referring to when I say utilization, is you actually have people moving into actual work.
Okay.
Uh,
I understand.
Okay.
Representative Hurd.
Roughly, how many, Mr. Commissioner, how many people do we have on TANF currently? Just
Let me ask my staff to help me with that, Representative.
We're running a little bit over 20,000 TNF cases at any point in time, usually about 3,500.
correct.
Adult-headed cases that have to have the work requirement. The rest are typically children who are placed with a relative, grandmother, aunt, uncle, whatever. In that case, the person is receiving a check on behalf of the child and doesn't need to work off the check.
So roughly 3,500 adults, and then
Participation requirement.
and then 20,000
Who are
Or
pretty much children
living with relatives.
Only pay for relatives. So if
Right.
a child is living with a relative, the relative can come in and apply.
Exactly.
To the DPAC's office, and if it meets certain criteria, we'll issue a check on the child's behalf.
Okay.
Healthcare cost of living.
Okay, thank you.
Could you tell me, a child in foster care under 5 years old annually, how much are they given for a clothes allowance?
My recollection is that it's $200 a year to start when the kid's initially placed, and $100, but I need to double check that.
$200 a year when they're initially placed, and then
I
the
think it's $100 a year, and then there's also, in many cases, the foster parent is using this.
yeah, but I know they don't get paid but like $15 a day. Isn't that right?
Correct.
Okay. Well, what I'm getting at, I really have a problem with us taking money that should go to foster care and spending $38 a year on a book when they're just getting $100 and something to clothe. And I'm going back to this $1 million for the first foundation that you contracted with. I want you to relook at that, because if we could increase their clothing allowance, hours on the education appropriations when they came and made the presentation, and they were turned down in the education appropriations. And then I look at the Georgia Budget Policy Institute tells us there's a waiting list for children and families on a waiting list for child care, yet we use this money for something else. And I really have a problem with that. And I've had children, and $100 and something a year to clothe a child is not much. And when you take 38, that's almost 33% of what they could get to clothe them. And I have a problem with that, and I wish you'd relook at the way we're spending that money.
We will do that.
Thank you.
Thank you.
Any other questions? Thank you, and thank you for coming.
Thank you very much. Appreciate it.
I'm good, my friend. How are you? Happy Monday to you. Holiday for some more fortunate than us. Hey man, how are you? I'm doing good, my friend. How you doing? Happy Monday to you.
I know.
It's in the discretionary portion of the federal budget. You hear people supposed to 20% cuts. Well, you know, it's a lot of our programs.
Has labor been here yet? Have I missed that? They're after lunch. Okay.
Veterans and a little bit between those ones, so it should be about 130.
Okay. Thanks.
A little bit. There's a little bit of a big portion that's coming out of child care.
We can use the money to give them more clothes. That really works. No, the library, they got school things and how much we put. But it's clothes. Wow.
Thank you.
Take care.
I know the ones DPAC does. I don't know everybody. I know the ones we issue. We do the community services 5.0 and the energy ones. 20 goes to the public hearings. Those goes after the community action agency. The federal law, they have a lot of authority on that. They're coming up with 50%. Budget under the president's budget. So they're going to get favored.
Thank you. All right, next we have Family Connection. Just introduce yourself, and I think we all know you, and we'll get started.
Good morning.
You're on. Is it on? Is it?
At the base, is the light on?
No, the light's not on.
Maybe flip it. Look, come on. Okay.
How's that?
That's it. Now you're on.
Okay, great. My name's Gay Smith, and I'm the Executive Director of the Georgia Family Connection Partnership. And I'm here today representing 159 county collaboratives, my board of directors, and thousands of volunteers and partners who've worked and helped us build the 20-year Family Connection initiative in Georgia. Basically, what I'd like to do with you today is just briefly go over the F12 budget recommendation, our reaction to the proposal to transfer funds, and I know that you're pretty familiar with who we are and what we do, so I will keep those comments brief as far as sharing with you a little bit about what you see at the local level with Family Connection and what we do at the state level. Our state appropriation is actually set up in two ways. It's a two-prong approach. Part of the appropriation goes directly to the counties to build a local collaborative organization, a local infrastructure, and each of those, you'll see this play out in your own communities in different ways, but each of those develop, implement, and evaluates a strategic plan, makes local decisions and sets priorities, and streamlines and reduces duplication locally, and is accountable for the well-being of the children in their community. Up to this point, we've been very successful at the local level having these collaboratives by working together, leverage your state appropriation for $5 for every dollar that they receive from you. So that is very much a source of pride for the communities and for us as a state as well. The second piece of the appropriation comes to help support a statewide system of technical assistance to enhance the work of collaboration at the local level as well as the state level. We also have this statewide technical assistance system to ensure accountability and results across 159 counties, as well as to ensure that we are learning the best practices from around the country and how to improve outcomes for children and families. What you have is a handout, a two-page handout and a timeline. In normal circumstances, I would be going over with you how we would anticipate absorbing the 8% recommended reduction in our budget for FY12. And what you see there is that we would propose doing exactly what we have always done at Family Connection. We would be taking the bulk of that 8% reduction at the partnership level, about 21% of it is what you see there, and then trying to minimize the impact at the local level because we believe it's so important that community collaboratives have the infrastructure and the resources they need to leverage additional resources so that their piece of the reduction would be about 1.8%. Per county. Now I'll provide our reaction to the proposal for transfer of our funds. We've worked long and hard in building trust from our private funders, the communities, our partners, and you, the General Assembly. And that's the kind of trust that can only be earned over time by honoring commitments and by having open, honest relationships. I'll be honest, when we first found out about this recommendation, it came as quite a surprise to us, our board of directors, and the 159 county collaborative organizations. At no point did we have an opportunity to discuss, prior to receiving this budget recommendation, the ramifications on the Family Connection work or on our public-private partnership. We don't understand the rationale behind the proposed consolidation, but have been forced over time to respond to inaccuracies to make sure that all points are understood as we look at this transfer recommendation. The first is that the Georgia Family Connection Partnership is not a state agency. We're a public-private nonprofit with funding from both state and private foundations. Our funding is roughly 80% public and 20% private. Our staff members are not state employees, and we are governed by a board of directors, which is over 50% comprised of people from the community around the state.
Are any of your employees paid by state funds?
Those that are delivering technical assistance directly in the field through the state appropriation are. The ones who are actually providing the administration of the 501c3 are paid by private funds.
How are you paid?
By private funds.
Are any of your benefits paid for by state funds?
No.
Are you on the state health insurance plan?
No.
Thank you.
Okay. The second misunderstanding is about our administrative overhead. You also have in your handout a breakdown, and I've also shared with Chase a copy of our FY10 audit. In our audit, it states that our overhead is 6.7%. Using the same calculation, we expect that our overhead in FY11 will be 6.3%. Another clarification is the number of staff that we do have employed in the partnership, and as of right now, that's 27.75. The third piece that I'd like to clarify is the issue around duplication. You'll also see in your attachment a timeline that outlines 20 years of milestones since the creation of this public-private initiative to today. What you will see is, if you go through the timeline, is that around 2008, with the creation of this new state agency, there has been the beginning of some duplication in language, but language only. And I would also encourage you to visit our website, where you'll clearly see the type of work that the Georgia Family Connection Partnership provides, the kind of support, the expertise, the tools, the data that we make sure that every single county and state partner has access to, as well as elected officials. So for 20 years, we've had one mission and always one mission, and that is to support collaboration at the local level and at the state level, no matter what. You can't really duplicate in 18 months what's taken 20 years for this state to build. Given our proven experience, to move our work to a new, relatively unexperienced state agency just does not make sense to us. Georgia Family Connection is a pioneer at working towards smaller government and improving local control. Becoming a sub-program under the Governor's Office of Children and Family risks local control and guaranteed allocation of funds to 150 counties, collaborative organizations. It just doesn't make sense to us either why in the world we would risk almost $22 million in over 20 years of private investment in building a national model, one that can't be replaced and one that we are constantly being sought for advice and technical assistance from other states who would like to replicate the work we have here with our 159 county infrastructure. So in conclusion, we have been resolute in our mission and our commitment to counties at all times. We pledge to maintain and enhance private investments in this work. We believe that the risks are too high to move the successful model to a state agency, but most importantly, we feel like the ultimate risk is not tied to administration or operations or the collection of data or the dissemination of data, but the real risk is to our most vulnerable population, and that's our Georgia children. We know that children live in families, families live in communities, and we believe that each community needs to have the support and freedom to make the decisions that they know best for the children and families that they are closest to and know best. So we are respectfully requesting that you remove the language from the FY12 budget that would transfer Family Connection dollars from an established nonprofit with a proven track record to a newly created state agency. And I'll be happy to answer any questions.
Representative Murphy. Oh, Representative Oliver. I can't get these numbers. At least I didn't call you a number and send you info.
Thank you very much. What are the $2 million, 20% of private funding? How are you? Can you give me a list of those, just your major private donors?
The Woodruff Foundation provides us with infrastructure unrestricted dollars. The Casey Foundation provides us money to support the Kids Count, primarily our quick Kids Count work. Mm-hmm. We've received a foundation grant from the Kaiser Foundation, and that's been geared toward our low birth weight work in 5 counties as pilots so that we could try to influence that low birth weight indicator that Georgia seems to be falling behind in. We also have received funding from the Walmart Foundation, and that has been to support communities in youth development and parent engagement activities.
And none of that is related to any of your local grants. All that's just directed
That's
to
just
y'all.
coming to the state. At the local level, there's a whole host of other private foundations who are involved in investing.
I think one of the confusions about overhead, to me, I'm confused, is the different views about the technical assistance grant, whether or not that's administration or whether that's direct service. Would you explain that to me again so I can understand it?
Well, as of right now, the state money that comes to the partnership is solely intended to support that technical assistance system. That is the people in the field. We have people stationed outside of Atlanta who do nothing but work closely with these collaboratives around strategic planning and evaluation.
And this is in addition, I'm assuming, to the $45,000-ish that goes to each county.
Correct.
Okay.
Correct.
And that's 527. How much is the technical assistance portion of your budget?
Let's see. I've got this number here. Our total admin, just straight admin cost is $0.64 million, and we have $6.72 million to support the 159 county collaboratives total.
So of the people in the state office, how many are assigned the people in the administrative budget, how many of them are assigned to technical assistance, and they're really outside of Atlanta?
22. 22 of 27, 27.75.
And the variety of places they're located out in the state, what kind of places are they located, or do they work outside their home?
Well, they're actually, sometimes they're given in-kind space in DFACS offices, school systems, county commission, community resource centers, or they work out of their offices, whichever works best. Mm-hmm. We are organized to match the 12 economic development regions and the DHS regions, And so we try to strategically locate folks so that they can get to those regions as quickly as possible with minimal travel.
How many people do you have working in your Atlanta office?
Let's see, we have 12.
And could you give me the total amount of the local grants that you're, I know I have 3 real good family connections in my district, Berrien, Cook, and Colquitt County, and their budgets. Could you tell me what their budgets are for each local?
Right now in FY11, due to the 4% reduction, those counties are getting.
No, how much they're pulling in, like my local.
Oh, I see.
Okay, like Berrien County Collaborative.
Well, let's see, the average collaborative is pulling in with its 42 to 50, probably another $500,000 to $700,000, depending on the county. Some are very effective and pull in.
I know mine pulls in a lot more than that.
Yeah, that would
Could
be
you give us can you add up a total of how much they're all pulling in and get those figures to us?
Absolutely. In fact, I have them. Ellen has them somewhere.
All right,
We'll
thanks.
get those to you just as soon
All
as
right,
the meeting's over.
thank you.
Yes.
Representative Manning.
Yes, I just wonder a couple of things. The .64 million is fully private dollars, so there are no state funds in that.
Right. That's how much we receive in our budget from private foundations.
I know my collaborative is relatively small. It only has 2 paid staff folks, and the rest are collaborative units. And we have been very successful with supporting that. So I just want to commend you for that. The second thing is that when you're talking about all the 159 counties, are there any counties that are not served by the collaborative?
No.
Okay. I had something else too I wanted to bring out. Let me think. You're 80% public and 20% private. When in your kids count, which is the brochure that I use almost like a Bible, except it's not the Bible, I understand that, but
Yeah.
but anyway, I look at it a lot. Okay. Is there any state funds used in producing that data?
Yes, because actually the grant that the Casey Foundation provides us for the work with Kids Count, we expand on that greatly since we do have this 159 county infrastructure. So we do add money to that so that we can get more information out, more technical assistance using the data. And also, if you visited our website, you can see it's pretty easy to use, and we try to do that on purpose so that more people will use the data. So yes, we do try to augment the Casey Foundation money so that we can make it bigger and greater.
Okay, thank you, Madam Chair.
Are there any other questions? Thank you, and thank you for coming. Next, we have Council on Aging. Thank you, and thank you so much for coming. If you'll just go ahead. Just introduce yourself. I think we all know you, but just introduce yourself anyway.
All right. I'm Ann Williams. I'm an appointee to the council, and I'm also legislative chair.
And I'm Catherine Fowler. I'm the executive director. And we'll be brief, but we do want to give you a little bit of information about what the council has been involved in. I know you see us down here during the session, but we work 12 months out of the year, so there are a lot of other things going on. For those of you who don't know, the council was created in 1977 by the General Assembly and given a charge to represent senior adults and their families through advocacy, education, outreach, and a number of different activities, and to advise the state about services, the quality of services, and planning for the future. Council members are appointed by the governor, the lieutenant governor, the Speaker of the House, and the Commissioner of the Department of Human Services. We have 20 members that include a number of people who are over the age of 60, but not all, and some who are providers and some who are consumers. And we have a very broad representation around the state now. If you drew a line halfway across the state around Macon, about half the folks are from below and half above. So we have a good statewide representation. I did give Chase a handout for you on our activities during the past year. And if you'll glance at those, you can see the variety of different activities that the council gets involved in order to carry out its charge from the legislature. One of the biggest things that's happened recently, of course, and I hope you did get copies of the report on your desk, is the completion of the 30-month project which the council was authorized to do in 2008, Project 2020 Georgia for a Lifetime. And what you have in front of you is the executive summary, which gives the recommendations from that report. And what we hope you'll note, if you flip over to the very back, is that we weren't just asking ourselves what needed to be done to prepare for the aging of the population. We had a lot of partners in this. We worked with the major research universities, many in the private sector as well as the nonprofit sector, and our aging partners. So it was a very broad-based effort, and we hope that the recommendations reflect that. We worked very closely with OPB and your financial folks and the Senate's financial folks to make certain that what we were coming up with were recommendations that were realistic. It's not just a litany of more services being needed and more state money being needed. A lot of it is about what communities need to do to get ready. Some of it is aimed at the private sector. That's an example of a broad-based activity that the council might take on. In addition, throughout the year, council members and many, many volunteers work on researching issues and developing legislation to bring to you, and ideas to bring to you, and needs to bring to you. We develop and present testimony at a number of different kinds of public hearings. We do a good bit of training and outreach to older adults around the state so that they can speak for themselves. And one of the things that we are working on now is being able to use more telecommunication with that, so that staff and volunteers are not traveling around the state to do training, but that folks can access that through our website and other kinds of electronic media. We work a lot with the universities. We do a good bit of presentations, a good many presentations to them. We have student interns who work with us. We work a lot with other state departments. And again, if you look at the Georgia for a Lifetime final report, the full report that you have on your desk and that you can also find on our website, you'll see reports from a number of different state departments. So we have been meeting with state departments like Department of Community Affairs, Transportation, BHDD, to talk with them about how the aging of the population is going to impact them. And certainly every one of them is more aware of it now than they were 10 years ago, as we all are. And their responses and their plans are included in that final report. Tomorrow, Wednesday, and Thursday, you'll see one of our big activities going on, Senior Week at the Capitol. So you'll see a lot of seniors here talking with their legislators. And we hope that you can make use of the Senior Issues newsletter that we publish weekly during the session and that we publish once a month, which is looking at senior issues as well as legislative issues and budget issues. If you don't receive that, please let us know. We're sending it to you electronically. If you'd like us to do it some other way, we'd be glad to. So briefly, that's what we're up to. A lot more is going on, and we stay very busy through the efforts of a lot of volunteers. We do track the volunteers that work with us and the value of their time. Volunteer Resources gave us over 96,000 hours of service this past year. So 2 staff are being leveraged into quite a bit, we hope. And the 20 council members are all volunteers as well. They do not receive per diems. They receive only reimbursement for actual expenses that they incur in doing what they're charged to do. So in looking at the tracking document, what you'll see is the 27.22.1 is the retirement increase that was factored in by OPB, and only one reduction on 27.22.2, which is the zeroing out of the Georgia for a Lifetime project as it is now complete.
Was there any was any money left in that was not spent?
No. We have had a sum total of about $15,000 allocated over the 2 years that was spent. The rest of it was reduced in various budget reductions. We ended up funding that work through other sources and not through this line item.
All right, thank you.
What the document doesn't show you is what I do want to briefly talk about, and that is that the council has absorbed a 28% reduction in its funding in the last 3 years, since fiscal year 2009. Some of that is the loss of the funding to Georgia for a Lifetime, but 26,000 of it is lost to our basic operating expenses.
What percent would that be? Taking out Georgia for a Lifetime.
It was about 12%.
12%.
Right. Which, when you're poor, amounts to a lot more than when you have a lot of money. Where that has really hit us hardest in this most recent year has been in the council member reimbursement, and that's what I just wanted to bring your attention to. As you know, within DHS, staff have been furloughed and so forth, so a lot has been taken out of that line item. This year, staff really haven't traveled. We have about $18,000 left to fund everything but staff. And that includes the council member reimbursement for travel. We have only $5,991 right now to fund 20 people trying to do their volunteer service. They have reduced their meetings from 6 meetings a year to 4. We do all of the things to find cheap lodging. They carpool, they even potluck. It's not a very professional way to conduct business, but it gets the business done. What we don't have, though, is enough money for them to be able to carry out things beyond meetings where they're actually doing the volunteer work. They do come together 4 times a year in conjunction with another quarterly meeting so that we're getting some economies there. All of their planning, their task force, their committee meetings occur by teleconference. So we use that quite a bit. So that they are not ever traveling in to do any committee work. What we would like for you to think about, and we know that you are very focused, and this is the only time you will hear us asking for anything other than service money, but we would like for you to consider giving them $10,000 so that they can do the jobs that the governor, lieutenant governor, speaker, and commissioner have appointed them to do.
Well, she certainly has summarized this whole situation very well, I think. And I do know, since I've been on this now for close to 15 years, that it's quite different now. Our economies are definitely been affected, and that it hasn't affected us as much as we will be affected if it continues on this way. The reimbursement, in the past, we've had a lot fewer people on the council, but we were appointed into a full complement this past year or so. So we do have many more people now at a time when we're actually cutting the budget. So this is, I think, just a realistic request on your part.
Well, as we said, it's the only time you'll hear us asking for anything besides home-delivered meals or respite.
Representative Manning.
Thank you for what you do. let me ask you a couple of questions that are not connected. One is your board members. What is their job? Are they supposed to have any input in actually pursuing legislation, or are they only advisory? And do they really do that work for you?
They are advisory, but we have a legislative committee, and they are very actively involved with us in the advocacy piece. We utilize a statewide association called the Coalition of Advocates for Georgia's Elderly, which the council started in 1987 to help determine what the council is going to advocate for. So it's not just 20 people in a room making that decision. And through that co-age process, some priorities are decided on by people from all over the state, and that is where we put the efforts. Where they are advisors more probably is when they're working with various boards, with departments, on task forces, and that sort of thing. So it's not so much legislative in focus as it is service advice.
Follow up, Madam Chair. The Meals on Wheels program has been so successful in my community. I just want to make sure that those folks are in fact continuing to receive and are being adequately served, because that's probably most vital to, I guess, everybody's community. So can you speak to that for just a second?
Absolutely. That's one of the priorities that we're working on this year. And if you look on your tracking document, because I'm trying to find it right now. There we go. It's 27.12.3. What that doesn't say is that's meals. It's under Elder Support Services, and it was the loss of federal funds due to the expiration of ARA. And whereas ARA funds are replaced in a lot of other places in the budget, they weren't replaced there. So we are really concerned about that line item. That is home delivered and Meals on Wheels and senior center meals. That's what that line item is.
Do you know how many people that hits?
Well, it translates to 138,000 meals. So it would depend on whether they get the meal 5 days a week or 3 days a week, how many people that would be.
And that's
27.12.3, and that's that 1,045,000.
And that's federal money? That's all federal money? There's not any state money in it?
Well, there was federal money. In 2009, there was state money in that line item, and it was replaced by ARA funds to balance the budget. And this is the year where the state funds need to be put back in.
And the 10,000 is not a part of that. The 10,000 is admin cost that you're asking for.
Well, the 10,000 is
for the council.
Council on Aging, which is the 27.22.
Yeah, she was talking about what we are advocating for here, and this was actually, we did have that 1,045,000 in our budget for meals. I mean, for the state, but they took that out and gave it to another agency, and then filled that hole with ARA funds. Which, when they knew when ARA was...
It was a one-time thing.
It'd be a one-time thing. Well, so now the hole is there, and there is no effort to try to put that money back. And that's one of our advocacy. I know that people are trying to find the money, but they have found money for other things.
Chase listening?
We were trying to go ahead, Representative Murray.
Thank you, Madam Chair. What agency was that money transferred? Do you know?
No, I do not know. I do not know what it was.
That year, there were quite a few different parts of the budget where state money was removed and replaced with ARA funds, and it was done primarily if ARA could be used for that, then that's where it was put, and the state funds might be used someplace else where ARA funds couldn't be used.
Okay. Right.
But I don't know that there's a direct correlation.
Right. Thank you. Thank you, ma'am.
Can we put unintended funds for that? Can't we?
The Division of Aging Services says no.
Are you sure? Representative Hurd.
Thank you. Thank you, both of you. As you probably know, Meals on Wheels is something very close to me, Catherine. As you know, I used to deliver those when I worked with the police department. Community Relations would pick up the seniors and take them to Dudley Park, and some would go to Brooklyn at that time. And if it had not been for that hot meal that they were afforded, they would not have anything hot to eat all day, and a lot of these seniors were really dependent on us to deliver that. And I'm sure this committee is going to do all it can, because it's very close to me. I've actually seen it in action firsthand. It's not that 138,000 is more than just a number to me. Thank you.
Yeah, I'd also like to emphasize that by you having delivered that meal, that quite often you were the only person that person saw that day, and could even check on them, be sure they were still being all right.
We became very close. A lot of the seniors did. I was like their adopted son.
Representative Murphy.
Madam Chair, I'm good. Thank
you. Oh, all right. Thank you, and thank you for coming.
Thank you.
Greatly appreciate the support this subcommittee has given our department. As you are aware, there are over 773,000 veterans in Georgia. And last year, we assisted in bringing into the economy of Georgia over $3 billion in VA funding. We are comfortable with the budget recommendations and seek your support for it. However, we do have some concerns that we will discuss them with you so that you might have a clearer picture of our operations. Mr. Dan Holtz, our Assistant Commissioner for Administration, Health, and Memorials, will make the detailed presentation of these recommended budgets and the changes in them. To provide detailed responses to questions, we have with us Mr. Tom Cook, Assistant Commissioner for Field Operations and Claims, Ms. Ren Loftus, our Budget Specialist, Mr. Rick Graham, our Operations Director, are also here this afternoon to answer and discuss any questions you may have about our fiscal situation and support operations. At this time, before I do, let me say that no veterans benefit is automatic. They've got to know about it and apply for it, and we are there to help them apply for it and get the money they deserve and would miss otherwise. We are bringing more money into Georgia for veterans than many states that have more veterans than we do, which shows that our people are doing a good job in assisting the veterans of Georgia getting all the benefits to which they may be entitled. Dan, if you would go into more detail, and we'll be here to answer any questions you'd like to ask. Thank you so much for what you do for us.
Thank you, Commissioner. The handout that you have may look a little daunting, and I'm not going to go through every single page of it, so I'm going to try and hit the high points based on the tracking sheet that Chase sent us with some highlighted items. I might just, before I begin, just mention very quickly, we just had a significant loss to our department this past Saturday. A gentleman who I think most of you know and many of you may have served with here in the House of Representatives, and that's Ken Birdsong. He passed away Saturday morning following a prolonged illness, and is going to be, the funeral is tomorrow at 11 in Macon, and following that he will be interred at our cemetery in Milledgeville. So I just wanted to mention that to you. I've numbered the pages, so I wanted to give you all this information so it'll be there. You can look at it at your leisure, but I wanted to right quick go over to page 5, which is our summary page, and it shows that we're looking at a overall budget for the department that started out in the budget process at a little over $40 million, and after an overall change is coming down to $38,776,000. And those changes, a lot of them, and which I will go through very quickly, appear to be significant, but in reality there's a lot of adjustment of some funds, and that's really what's going on with most of it. If you come over to page 7 in our administration program, section 48.1, there were 2 items that were highlighted in the tracking sheet. The first is 4814 and the second is 4815. The overall operating expenses for the $6,800, that's travel, supplies, utilities, etc. And then that $159, and believe me, unless they stick it back in there again, but for some stupid reason, this is the last time I think you're going to see it, because I know you saw it in the FY11 amended, and here it is again, and we're finally, I think, getting rid of it. So that should end up with that one being taken care of. The cemeteries, there were no highlighted items on that, and so we can skip that and go over to page 11. And this is where we start getting into some of these adjustments that I was talking about. The first one, 48.3.1, is an adjustment that is related to the fact the VA has changed the reimbursement process for our state veterans homes. Specifically, they raised the VA per diem rate up to $94.59 a day per veteran. Well, federal law says if your costs are not in excess of that, they're not going to pay the full $94.59. So our costs in Georgia are significantly less than that in terms of our federal dollars compared to our state dollars. At Augusta, we're running somewhere around $165, $166 a day total. At Milledgeville, it's $163.42. And when you divide that by 2, it comes out a lot less than the $94.59.
And tell me again, in Augusta, what is it per day in Augusta?
It's about 165, 166, thereabouts. It varies per month based on actual cost at Augusta. Because
and Milledgeville is how much?
It's $163.42 total, or $81.71 for state and $81.71 on the Fed side. And that $94.59, if we were up in Connecticut or Maine or New York or some of those higher cost states, they would in fact, their costs are so much higher than what they are here in Georgia that they're getting that full amount. We're not. And so we're getting the same amount of money on a cost per day basis from the feds as we have for the state side.
Does that include the aid and attendance?
No, that does not. That's strictly state appropriation and federal per diem payment.
We had talked about pulling down aid and attendance. Are y'all still thinking about doing that?
As we explained to you when we had the briefing on the Medicaid Medicare study, and that was the recommendation that came out of that study report.
No, I thought one of the things that came out was I thought you could pull down aid and attendance.
We can't collect it though. And that's what the whole issue of the piece of legislation.
Oh, you can't collect
we cannot collect it, ma'am.
Why can't you?
There's no authority in Georgia law for us to do that.
Okay, if we passed a law, how much would you pull down?
That would be dependent on what our overall needs were. But if we did the daily figure for aid and attendance, which is $21.96, that would generate something in the neighborhood of $3.2 million for both homes.
And that would be federal money coming down?
Yes, it's federal money that's going to the individual veterans now, and we would be collecting it from them.
The aid
yes,
and
ma'am.
attendance. Do most states get aid and attendance?
Yes, ma'am.
And we just haven't done it.
There's no provision in Georgia law for us to collect, so we can't do it. That's correct.
Okay. All right. Thank you.
Surely.
Representative Manning.
Why is it that we're not asking for the aid and attendance? I'm not really sure what that means. Aid and attendance.
Aid and attendance is a VA term. it's a benefit, a medical or a health care benefit that is provided to veterans who have medical needs. When someone who is a veteran goes into a nursing home, for all intents and purposes, they are authorized to claim that benefit and receive it, or depending on what their income is. If there's an income threshold on that, and if they're over income, they are eligible to receive it, but if they're over income, they're not going to get the cash benefit. So if they're below the income threshold, they can not only be eligible for the benefit, but also receive it. Now, the way that benefit is structured, it is claimed by the individual veteran, who then receives that money from the VA, assuming they meet the income requirement. If they get it, the way it stands right now, today, they get those dollars and they're able to keep them. And that's because in Georgia law, there is no authority for us as a department to then collect those monies from the individual veteran, even though they're getting them.
But the federal government is getting them because they're in a nursing facility.
The federal government is paying them because they're in a nursing. That's correct.
Facility.
Now, if they were in, I'm sorry? Yes, roughly $3.2 million. Yes, ma'am. Now, if they were in a community nursing home, they would be charged by that nursing home for that care.
That $21.
Well, and they would be able to use that aid and attendance as a source of paying some of that money to that community nursing home, plus Medicaid if they have it, plus Medicare if it's appropriate.
So it's $21 a day?
$21.96 a day.
Okay.
$660 some odd dollars a month.
And that's in addition to the benefits?
Yes, it's on top of any compensation or pension that they might be receiving.
Okay.
And that's where the study group, when we looked at the Medicaid Medicare issue, the study group said, let's focus in on benefits that are there and available.
Have y'all had any legislation written up, or you?
We wrote some up. It's attached as part of the report that was submitted.
Did you give it to somebody to?
We talked to the governor's office about it, and the governor's office said they did not want to support it at this time.
So the governor's office is not supporting this?
At this time, that's correct. In fact, they're not supporting any agency legislation at this time, according to an email we received shortly after we talked with them.
Okay, so it's not that they're not supporting us collecting this money. They're just not supporting any agency, for any agency?
That was the email that we got, yes.
All right.
From the governor's office?
From the governor's office?
Yes, ma'am.
All right. Representative Oliver.
I'm trying to remember various hearings in the past. So do you know how many of your veterans in your homes actually collect this $21.96 for their own personal funds today?
It is somewhere in the neighborhood of about, well, let's see, at both homes, I think we're looking at something in the neighborhood. If we look at roughly 300 residents, if we use that number, that are actually receiving the benefit of that 300 is probably in the neighborhood of 140 to 160.
So not inconsistent with the number that you said was Medicaid eligible, which is 40%.
That's correct.
In addition to them being able to personally receive that benefit as an income, am I remembering correctly that they also can personally receive their monthly VA benefit check also?
That's correct.
As income?
Yes, ma'am.
And none of those monies go to their care?
That's correct.
And when Medicaid funds are paid, if they accepted Medicaid funds would go to the state in a traditional nursing home, but $25 of personal income, they could keep $25 of personal income for the patient. Is that
I believe
correct?
That's correct, yes, ma'am.
And did Georgia have to pass a law that allowed Georgia to accept the Medicaid benefit?
Well, there was, I believe, some statutory authority way back when. I don't know all of the details on it, but that then implemented the Medicare-Medicaid Act, Title 18 and Title 19.
But do you know specifically? I don't know specifically.
I don't know specifically, but I presume that's the case, yes.
And your position on the state not being able to accept the money of the per diem money, is that based on the statute not affirmatively allowing it, or is it based on the statute saying we will not allow any veteran to contribute to his or her care?
The statute does not affirmatively allow it.
So you're choosing to interpret that as a prohibition as opposed to an allowance?
Based on the legal advice we've received from the law department, yes, ma'am.
Okay. It might be fair that to say then that the governor's decision not to have a legislative agenda of his own, you were asking the governor if he would put this bill to state to allow to accept this money as his personal legislative agenda. You could ask any other legislator to introduce that bill yourself, couldn't you, and it not be part of the governor's agenda?
We could, however, we've chosen to follow the lead of the governor. But obviously that would not preclude any member of the General Assembly from, signing on to the legislation and putting it into the system.
And y'all do not accept Medicare benefits either?
No, ma'am, we do not.
Limited services that are
right. It's the same lack of affirmative authority that we don't have that precludes us from accepting anything other than state appropriation and VA per diem.
Am I to understand this, that the family gets $600 more when they put them in the nursing home?
If their income level allows them to collect the cash benefit, yes, ma'am.
Representative Hurd.
What is that income level? Do you know what that income level is?
Tom Cook, do you know right off the top of your head?
Well, it roughly equates with maximum amount of the pension. So it's about $1,900 a month, thereabout.
That's what they're allowed to make, up to $1,900, or
off the top of my head, but it's in that neighborhood, yes, because the pension is assumes zero income, so the maximum amount of the pension then is reduced based on other sources of income. So if there are other sources of income, then it would zero out the pension at the maximum amount of pension level. So roughly we're talking about $1,900 a month.
right. So what I'm hearing you say basically is particularly at any time, but at this appointed time, $600 would be very useful to a lot of our vets.
Yes, sir. And the other thing that goes along with
per
this,
month.
Yeah, per month, right.
Yeah.
The other thing that goes along with this, and Tom alluded to it, each year a veteran who's receiving compensation or pension fills out an income form and submits it to the VA. If they show medical expenses on that form, that goes against that income level and lowers it, okay? So that puts them below the threshold and would allow them to receive that cash benefit. Where right now, those who are receiving that cash benefit or might be eligible for it, and because of their income level don't actually get the cash benefit, it's because they don't have medical expenses to offset it.
Offset it, right. Okay, thank you.
Representative Murphy.
Madam Chair, my question has been asked. You all
All
have
right.
covered my concern.
All right, thank you. Now, I've got one other question. Are you telling me the governor just would not support this? Is that what he said?
The initial response we got from the governor's office specifically said that at this time they did not want, they would not support the piece of legislation. And by quote, it says, "We do not support this legislation, and therefore we would prefer not to pursue the initiative at this time."
All right, thank you. What? Is anybody here from the governor's office? it's okay. He took his badge off.
I think he ran for cover.
Okay, go ahead. So-
Okay. If you want the guy's name, I've got it here on the email.
okay.
It's Dan Rubenstein, okay?
Okay.
And then as you and I, Madam Chairman, talked about when we did the Medicaid, Medicare briefing, within about 3 days of us receiving that email is when the across-the-board email came out and said we are not going to support any agency legislation at this time. So,
Okay. I didn't know if you mean agency legislation. It means legislation that they wanted the agency for their floor leaders to carry. I didn't know if that's what they were talking about. I didn't know if it might be a play on words that we might need different things.
yeah, and it might be, and I can't answer that question.
Okay.
All I can tell you is what we received.
All right.
The second highlighted area was the replacing of state funds with increased federal per diem, and that's that $287,000 that is directly related to the 70% service-connected disabled veterans for whom the VA is now paying 100% of the cost of care. So when you net all of that out and you look back on page 10, you see that there's a reduction in federal funds of $758,000, but that's that will be largely ultimately determined when we get into the fiscal year as to how much federal money we actually receive based on actual days of care. On page 13, same kind of issue for Milledgeville. There's a $198,000 adjustment there on the federal funds to balance it because of the $81.71 being paid on state side and on the federal side. And then there's $282,000 on the 48.4.2 that is related to the 70% service connected. There were no items highlighted on our Veterans Benefits program. And as I said, I was going to make this sweet, short, and simple. And with that, I'll give it back to you. And if you have any more questions, we'll do our best to respond to them. And if we can't, we'll be happy to take them for the record and get you a response back.
Did you say that your agency had some language that would we need to put in Georgia law so we could get attendance and aid? Did you said you had some language drawn up?
Yes, we
about
have.
That? Okay.
And it's attached to the Medicaid, Medicare report, which you have a copy of.
All right. Thank you. Any other questions?
Did we resolve that?
Cemeteries.
Did we resolve that by retaining those two individuals? Or?
The funds were retained, and we have retained that we didn't take any action to reduce the staffing at either of the facilities. No, ma'am. So
where is that on your budget?
Page 9, page 8 and page 9.
It's page 48.2 on your tracking thing.
$48.24. Is that what? No.
Well, it's actually it's the entire section 48.2 is the cemeteries.
On this thing. I'm sorry.
Any other questions? Representative Manning, did you have another question?
No, ma'am.
All right, thank you. Thanks
Okay.
for coming.
Thank you very much. We appreciate it.
I would too. Thank you, Commissioner Butler. If you'd like to sit down, or we're ready. And we're running a little ahead. I don't know if we're ahead or behind, but we're on time. Thank you. Thank you. And I think we all got to have a tracking. Are you going to operate off this tracking document? Sure. Just give us a few minutes while we regroup.
Give Chase a copy.
Yeah, okay, thank you.
Okay. All right, what we'll do is we'll just go through this. If you want me to go through it section by section and just kind of hit the highlights?
Please.
Okay. All right, well, in 31-1, mainly what, probably the most important cut to take a look at there is on the reduced personnel services at $30,750. The only thing that we would request that the committee do is, and we just gave Chase a copy of a different sheet that's got, it tracks the loss of federal funds throughout the entire document. When it was sent over, it did not track the loss of federal funds. It just had the state funds without the corresponding federal loss. We just want to provide that to you so you'd have it to give you a correct number. We found a mistake. We would have had a bunch of them, but we found a mistake at the last minute and just barely got enough to come over here with. Matter of fact, I'm using the uncorrected copy right now, but he has it. But on the loss of state funds, it's a total loss of federal funds of $108,181 on that one. On the administration budget, you'll see some losses there through the telecommunications. I'm going to skip over the telecommunications cuts throughout the document because it's the same throughout the whole document. It's basically, which I'm sure is, if I went and looked at everybody else's budget, it's probably the same throughout theirs too and all the other departments. With that, we'll skip down to the next section that has significant cuts, and that is 31.4, Division of Rehabilitation Administration. There is a reduction of contracts there and a reduction for personnel services. Loss of federal funds on that is $154,880. On the contract funds, that actually reflects a 22% reduction in contract funds, which is above the 8% that you typically see throughout most other programs as a cut. And that's stuff like Gotcha radio reading service.
Gotcha's cut?
Yes. Is that one on that one? Yes.
Can you give us a copy of those contracts that you reduced?
Yes.
Did you reduce them all?
No, we only well, we didn't make that cut. We sent over the required cuts, which were at 4%, 6%, and 8%. And so the additional 22% was not our suggestion. Now, keep in mind, this is everything that was sent over to the governor's office was sent over before I got there. So we had to play kind of catch up and had to go back and look at what we sent over, but we did not send over 22% cut. So no, it was this 4, 6, and 8. But that's what this document reflects right here. What is actually in the governor's recommendation is a 22% cut in the contracts. But we can get you a list of all the ones.
So he just helped you out a little?
I don't know if I'd call that helping, but and then on Georgia Interest for the Blinds, 31.5, another reduction. Services, there's no federal match involved in that one. No cuts in labor market information, which is the next section down, because that's all federal funds, 100%. Roosevelt Warm Springs, This is reduced funds for equipment. I think we touched briefly on that in the last budget hearing, talking about the fact that we'll have to get together as we kind of go through and y'all start working on the through the bond packages, which I guess goes to a different committee. We can probably talk to them about possibly looking at bonding some of the equipment changes, so we can get by with that cut. And then the reduce for what's that one? Yeah, we got that one. And then also has there's another reduction in contracts here, and that is on the Blaze sports contract. And then there's also on the next page, which is 31.7.5 reduction in personnel services. Loss of federal funds in that program is $307,410. This will basically cause a loss of 27 hourly positions. Most of those are direct patient care. Safety inspections. We actually saw a little bit of a restoration of some of the fund. Well, all the cuts that were made in the amended are put back in this one, and then with a small increase. But most of that goes into the for the retirement system and whatnot. We still do have a budgetary problem in that program. The fact is, we're even with the restoration of the funds, which I do appreciate. Thank you very much to the committee chairman on helping us out in the amended. We're still about a little over $200,000 short of being able to maintain this program at the current staffing that it is right now. We're going to try to look for efficiencies where we can. Well, there's not a whole lot of places to look. Like I said before, this program is basically all travel and personnel. That's it. And the travel goes hand in hand with the personnel. Obviously, the personnel is your salaries, the people who have to do the inspections, and then when they use their personal cars to do these inspections, and then so they are reimbursed for their mileage and wear and tear on their car. So. Okay, I would like to come back to 31.9 and basically end my presentation on that one, if that's okay with the chair.
That's fine.
Going to take a little bit longer. Go down to 31.1, the vocational rehabilitation program. I believe that the House added some funds last year for the Georgia Talking Book Center in Augusta. Those were removed in the governor's recommendation. That is the facility which will be directly affected by that cut. And then there's also a reduction in personnel services. This is one of our largest losses in federal funds is in this particular budget, and it's a loss of $5,186,219. These are funds in which we can draw down from the federal government, but if we don't have the state match, we won't be able to draw those down. The service contracts that were cut reflects about 11.5% reduction in service contracts, which is more than the 8% that most agencies have taken. In workforce development, 31.11 reduction of personnel services. This is the program in which we use to help get people back to work, help get them connected to training when so needed. We'll go back up to the 31.9. This is
what I'm sorry.
Were there any workforce dollars lost, federal dollars lost? Well, it's basically all federal dollars, correct?
well,
It's all federal dollars, but are
for
we
the most
using any
part.
additional?
But there is. It depends. It depends on how you want to define state versus federal. There is some administrative assessment money that we use, which there is an ongoing discussion about how that should actually be classified. We have the opinion that it should be tracked separately from state dollars because it's a percentage that comes off of the state's unemployment trust fund, and it is used or it was set aside to expressly to help get people back to work faster, so that way they're not on unemployment as long. And so that's where those monies come from. The state fund you see tracked right there actually from the AA money, administrative assessment money, which does come out of the fund.
So, all right. So with those cuts, there's no federal match or in jeopardy or anything on the workforce development.
Well, no, there's not a match.
Right. Okay.
Yes, you're
It's
correct.
basically all federal dollars. Yeah.
Correct.
The $6.4 million is federal dollars.
Representative Oliver.
I
had another question, but just is the $6.4 billion
state.
at 31.1? That's state money.
That's state money.
That comes from the administrative assessment.
Okay,
That is.
That's what I was.
Yeah. Yes.
Gotcha.
Well,
So it really is federal money. It's your administrative share that you're then
it
putting-
comes from the state's unemployment tax fund.
Correct.
Right. And that's a statutory administrative share.
Yes.
Okay. That's what I thought you were saying.
Yes.
Right.
But my question is may I ask another question?
Yes,
Chair?
please.
What has been your patient population at Warm Springs? I assume it's going down with this kind of staff reductions. Yes or no?
Well, no. The staff reduction. Well, the staff reduction does not correspond to a reduction in patients, and plus you've got several different populations of patients. You have people that are in the hospital, and then you have outpatient services that we have in several different places. And I want to think, what was the total on the out? You had I think total patients that are served was somewhere over 3,000, but inpatient about 3,700 patients served a year. That's outpatient. Some of those are on a continuing basis. And then as far as the people that are there, overnight, what was the last, was it?
How many?
Okay, that's total patients though. Okay, yeah, 3,300 was a total patient. Sorry, I have that wrong.
But you have a residential population.
Yes, we do.
there.
It's I want to think it's a fraction of that.
Yeah.
It's
Is it as many as 100?
Yeah, I want to say 140 or so, but I'm really hesitant just to go blurt. Well, I just blurted it out, so I mean, it really
Is
matters.
that rehab services?
Yes.
Just the rehab services?
And
I was down there, it looked like more than 100.
Well, that obviously changes over through time. So, and plus you have a lot of people, who may not be there overnight, but they're in and out of there every day.
Yeah, perhaps this is the easier way to ask the question. How many, what's the residential population, what's their average length of stay? But you can get that back.
Yes, we can get that for you. We don't have that here today, but yeah, that's not a problem. When I was briefed on it, right when I came on, I went through all that with them and got that.
I have the impression, this is where I could be wrong, that most of your residentials are there for a period of time, whether it's 30 days or 60 or 6 months. I'm curious about that.
Okay.
And
Yeah,
is
we can
that
get
number, residential population, changed itself?
Yeah, we can get that for you. It's not a problem. Okay. Back up to 31.9, unemployment insurance. This is the part of the document which you will see the language in here which says utilize state funds to pay first installment of the unemployment trust fund loan. Right now, currently date, we're right at $635,000 that we've had to borrow. The interest on this comes due September 30th. How much? Million. What did I say? Sorry. That's million. 635 million. And anyway, so the interest comes due on that September 30th. It's estimated the interest on the payment is going to be about $24 million. I think some of y'all have been briefed individually about this. As you see in the tracking document here, there are actually no state funds listed in the line item. It's just language. In this particular program, the only state funds that are in there is the administrative assessment funds, which we were talking about earlier, and it's 5.5. And so program-wide, we do not have $24 million to pay the interest payment. And so between now and when this final passage of this budget, I just want to make you aware we do need to have that money put in the budget, because the only way that you can take $24 million out of the Department of Labor is you would take it out across every single program that we had that has any state funds, which would be a little over 66% of all of our state funds on top of the cuts that we have incurred. So you're really talking close to 70.
Yes, go ahead.
What is the status of the state's collective effort trying to get the federal government to hold off on collecting this interest payment? That politics is going on in Washington. Do you have any guess about that?
You want me to guess policy in Washington?
Yeah. Am I correct that that's an effort that the states are doing?
Yes, we are actively engaged in that effort. Matter of fact, I will be in Washington Wednesday, hoping and talking to our delegation, members of our delegation, and explain to them how that it would be very beneficial to not only the state but the business of the state if we could hold off or push back the interest payment to a year, maybe 2 years. However, you have to watch these. There's a carrot and a stick involved here. You have to be very careful about what the federal government puts out there for you. On the front end, some of the stuff that they've offered looks really great, but there's a cost, and there's just a back end cost, and generally it's the business of Georgia who ended up with that cost that they're going to have to incur. So we're watching it very closely, being very vocal with our partners in Washington to make sure they understand that, yes, we would like them to work with us. However, we don't want it to we don't want a short-term help be a long-term hindrance, and so that's kind of where we're at right now.
And the timing of that really doesn't, if I understand correctly what you're asking us to do, the timing of that really doesn't matter because all you're asking for is language to find the money if you have to pay it in September. You're not asking here for $24 million. You're saying this could come.
Right, well, as it stands right now, it's coming. And so, my theory of how to do this, I have to present to you what the facts are today. Predicting what Washington's going to do, I think that's very dangerous for us to lean on. Right. But I mean, we do need to identify funds that we may need to have because if we don't make this payment, the penalties are quite severe. And it's nothing that anybody wants to have to answer for. I can promise you that. It's a loss in credit on the I'm sure everybody here knows this, but you have state unemployment tax and you have federal unemployment tax. The employers of Georgia get a credit on the federal unemployment tax. It's 6.2%, but right now they're only paying 0.08. And one of the reasons why they don't have to pay that is because they get a credit because of our state program and the fact that it has been run well. If you don't make the interest payment, that wipes away all that credit, and it runs that tax up to 6%. For all our employers, it's a hefty chunk, and plus, I mean, you would lose all your federal funding for your UI program. So I mean, it's not one of those things you want to kind of put off, and we need to be aware that have to take it very seriously because it has very serious repercussions if it's not paid. And it's one of those kind of situations. I mean, as try as we might, I mean, we find ourselves in this situation. And we just got to deal with it. So there are no easy solutions, but we are looking at everything.
Representative Manning.
I guess my question is, how were we able to borrow that much money?
Well, that's just how it is. I mean, that's how the program is set up. I mean,
is that a rolling amount? I mean, does it
yes,
increase?
Yes, benefits paid out on a weekly basis. And so right now how it is set up, we request funds from the federal government to take care of what we've got to pay out right now because we have very little coming in. Of course, now we've had this month we've had a good bit of state unemployment tax come in, which has kind of held the borrowing off a little bit. However, our projected receipts for March are going to be very low, and so we will have to ask for additional drawdowns from the federal government in March. For this year, we shouldn't have to borrow past April because April, starting after April, our receipts should be fairly strong on our state unemployment tax for that first quarter receipts. That's where the bulk of all the money for unemployment tax on the state side is paid in the first quarter. And so we should be good for the rest of the year, not having to borrow any additional.
Okay. On another subject, what is our usual match? So what will we be losing if we take these 22% cuts or whatever? I mean, how much?
Well, it depends. A lot of if you're talking about the contracts, it depends on which program we're talking about. Some of the contracts there is no match for. It's purely state funds. I think there was a few. Which ones? Is it the ones on the?
Yeah, we have that, like Gotcha.
Yeah, Gotcha. On those, there is a match. Is it 41?
No, there is no match.
It used to be 80-20, didn't it?
That's the one that there is no match on. The one like Gotcha and all that. That's purely state funds.
Is there any way that we can tell about those, or can you give us a copy of the list of how those? I know it wasn't your choice, but can you just provide us with those? I'm concerned about the ones that are in Cobb, particularly.
Okay.
The Tommy Novus Center and Goodwill and some of those. that,
What if we just get the committee a list of all those contracts and then put a notation out to the side of the county which you're located with? Would that be okay?
That'd be great.
Okay, we'll do that. How about that?
Representative Hurd.
Thank you, Mr. Commissioner. I guess my question is in reference to these cuts also. Do we have any idea of how many people will lose their services through these cuts?
Well, we're going to try to manage it best we can, and I know in a lot of the areas when you have a lot of the ones that have contracts that have private funds. Now I'm not belittling what they're losing by no means, and I know that I have spoken with many of them. They've come to see me in my office.
Right.
I've gone out to their facilities and toured them in the little short time that I've been in office, and they're going to try to get by best. We're going to try to minimize that, but to give you an exact number.
Any idea how many people?
It'd be very hard to pinpoint that, and the reason why that is, a lot of those services, can depend upon, the economy and different things that happen, and so it can fluctuate, just like unemployment, fluctuates. We can have a good month where we don't have as many people going on unemployment. We can have a bad month. Anything can happen, but we can try to get you as, best guess as much as we can as far as any kind of actual numbers on that. But it'd be really difficult to speak for, especially on the contracts, to speak for those organizations, because there's several different ones, and they all have different plans in place in order to deal with these cuts. But we're going to try to work with them best we can.
Are we in jeopardy of losing any of those federal dollars due to, I guess, everything has a maintenance of effort? Where are we when it comes to that loss of federal dollars?
The maintenance for effort loss through about all of vocational rehabilitation is about $1.1 million.
Okay. Now, is that in addition to the
yes.
5.8?
Yes.
Oh, that's on top of the 5.180.
Yes.
So roughly about 6.162
Yes.
million. Okay. Okay. Thank you.
Any other questions? Thank you, and we appreciate it, and
It's always a pleasure.
it's always a pleasure to see you. Let's see.
You talking about the live vote?
Just tell her. Tell her again. Yeah. That's just for the interest. Thank you, Georgia. I feel like I'm down. Is my seat lower? Really, is my seat lower than everybody else? I wondered what was happening. I couldn't. I wondered why I couldn't see anybody. I wondered the whole time I've been stretching my neck. Oh, that's so much better. Thank you. Now that the day's almost over. Thank you. Oh, just go ahead. Thanks.
Madam Chairman, members of the committee, I'm Eric Jacobson, the Executive Director of the Georgia Council on Developmental Disabilities. I think you all know Pat Noby, who's the Deputy Director. My presentation hopefully will be much shorter and easier than the one you just heard. Essentially, the council is primarily federally funded. We get about $2.2 million in federal dollars, and as proposed in the 2012 budget, we'll get about $45,000 in state money. That's a reduction of about $5,000. That primarily will be taken care of through administrative changes. It won't reduce any of our programs at all. The two things that I always say to you when I come talk to you about our budget and any reductions is that we do have a required 25% match in order to draw down those federal dollars, and we primarily get that match from two sources. We get it from the contracts that we go into with nonprofits from around the state. As you know, those nonprofits are all having more and more difficulty coming up with especially cash matches on any kind of contracts, although we do, and they are allowed to do in-kind matching as well. The second area in which we get matching dollars from is primarily from the Department of Behavioral Health and Developmental Disabilities, and that's again, in-kind support to the council. What's happened, though, is that over the last couple of years, they've not been including that match in their budget around IT issues and telephone issues. And as they don't include it in their budget, then we have to take it out of our budget. And again, those matching dollars aren't there as well. So it makes it so we have to pay more of our budget for IT and telephone support or telecommunications support. Essentially, that's our budget, and I'll be more than glad to answer any questions.
Do you have any questions?
I told you it would be easier.
I have a question. Okay. You said there are a lot of individuals with disabilities that are in nursing homes that would really like to be living out in the community.
Yep.
How much money would we save by transferring those people out in the community from nursing homes? Do you have any idea?
I don't know if it would necessarily be a savings because they would need support in the community, but you'd be spending those Medicaid dollars from the nursing home in the community, and people would have the opportunity to go back to work, be reunited with their families, raise their children. We're not sure. In fact, we've actually been trying to have some conversations with the health side of the House Budget Office and the Department of Community Health to sort of get a better handle on what nursing home costs are for people with developmental disabilities and what the cost would be in the community, and see if that would be a better use of state dollars or Medicaid dollars.
How many people do you think you have in nursing homes that really do have developmental disabilities?
1,600.
1,600.
It's more than twice the institutional population, the state hospital population.
Okay. Any other questions? Is that it? Thank you.
Thank you.
Thank you.
That was short and sweet. Thank you. The next, we were supposed to have the Sexual Offenders Review Board, but they couldn't come for some reason. They have a problem today, and I think we only have one or two questions we need to ask them left over from last time. And any other questions y'all want to ask Sexual Review Board, if you'll get it to Chase, we'll get you the answer. And next we have the Governor's Office of Children and Family. Hey, good afternoon. Let us shift papers around. It'll take us a few minutes to I tell you, this paperless society. Huh? No, it didn't. Okay, let's see.
It's section 26, if that helps at all, and where you're trying to find it. Doesn't help.
What is
I would give you a page number, but ours is only 3 pages, so.
That's about the embrace.
Oh, do you need more? Oh, okay. Oh, sure. I thought I gave more than enough. So. Just to be sure.
Thank you for coming this afternoon, and we'll let you present, okay?
Great. Thank you so much, and thank you, committee members, for allowing us to be here to present today. My name is Jen Beneke, and I'm the Executive Director of the Governor's Office for Children and Families. We're newer to this subcommittee. We used to be under general government, so for those of you that aren't quite as familiar with our office, I'll give you just some brief highlights. The Governor's Office for Children and Families seeks to build capacity in communities in order to improve outcomes for Georgia's children and families. We do this through grants to communities, and that's everything from child abuse prevention to juvenile justice, family violence, those sorts of things. Excuse me. We also do this through training and technical assistance and through facilitating collaboration among partners. In all that we do, we strive to ensure that Georgia's child welfare resources, whether that be funding or policy or personnel, is utilized in the most efficient and effective way and is properly targeted, consistent, and effective. If I may, I'll go through, if you all are able to find in the tracking document where we are, I'll just go through and give you some of the highlights of that. Our total state appropriation is about $4 million, just over $4 million. Our total federal funds is about $4.6 million, and that's from a variety of different federal funds. I can itemize those later for you if you'd like. And then other funds, which is some TANF swaps that we had done with the Department of Human Services, and that's about $3.8 million. And I can give you some history on that if any of you have questions on that. And that totals to about $12.7 million.
What about your Children's Trust Fund? What is that? How much do you get out of that?
The Children's Trust Fund was one of the prior agencies. We were the Children's Trust Fund and the Children and Youth Coordinating Council, and we merged into the Governor's Office for Children and Families.
Don't y'all get a fee for fines or something? Or?
No, ma'am. We don't. I'm sorry? We don't charge any fees to our agency.
But what feeds the trust fund?
Oh, I think what you may be referencing, and we actually don't charge any fees, but the Children's Trust Fund, when it was first set up, which mirrored other states as well, it actually has a separate treasury account in order to continue to generate interest, and that can be utilized back for these child-serving
Well, how is it
activities.
funded?
Those are state funds. It's what the balance in that is the remainder of unspent funds over the years and interest.
Well, in these fees and fines, a filing fee, didn't that used to go to the Children's Trust Fund?
Not that I'm aware of. I don't.
Maybe
years
Representative
ago.
Oliver.
The trust fund was created by constitutional amendment that comes from vital records fees and divorce filing fees and all of that. It always has been separately maintained, but you are in charge of that money, is that correct, under the new statute?
Yes, ma'am, that's correct.
And is it accounted for on the tracking sheet?
No, ma'am, it is not.
Okay. So we'd like to know how much is in that fund,
Sure.
because we have been given some information, tell me whether this is right or wrong, that you're not spending that money, that there's a $9 million lapse this past year on that particular fund.
To first answer the first question, yes, there is about $9 million in that. However, we do spend this on enterprise activities. So, for example, we spend this on any activities that the Georgia Children's Cabinet engages in. So any projects that the Cabinet needs resources to administer, we provide the funds from this resource.
If you go back to the original statute, which I'm sure you've done, it was for child abuse prevention, and it was a grant program.
Yes, ma'am.
And I think one of the things we'd like is to see what grants you have been funding with Children's Trust Fund consistent with the original statute.
Sure, absolutely.
And
we
that's
can
why
certainly provide that.
I can't figure out why you would have that much money accumulated in that separate fund. It would imply that you're not making grants out of it, and that's what I'm confused about.
Historically, it had not been. We had utilized the state appropriation and then also the federal HHS grant that had been appropriated. We utilized those funds for all of the all of the grants and administration for the Children's Trust Fund. At that time, it was about $7.5 million state funds and about $1.2 million federal funds. So we utilized those appropriations for all of the grants and administration technical assistance. But then over the years, any funds that had lapsed went into the Treasury, and the Treasury also generated interest.
I didn't think you could lapse into the general Treasury, a special designated fund, but am I correct? And I'd like you to introduce your gentleman with you.
Yes. This is Lydell Samples. He's our finance officer.
Okay, good. That's what I was hoping. But that's what's confusing to me, that you accumulated $9 million of special Children's Trust Fund money, which means you haven't spent it on any of the statutorily required programs, and that's why I'm confused.
Right. Historically, prior to my being appointed the director of the Children's Trust Fund, the Treasury dollars had not been spent at all, and so we then developed the policy in coordination with OPB and then our other agency stakeholders in the governor's office that we would utilize that on enterprise projects.
I don't know what enterprise projects are because they're not statutorily required under the Children's Trust Fund statute.
Because of our statutory obligation to convene all of the state agencies to look at emerging child welfare, juvenile justice trends, it was an opportunity to utilize these funds for projects that crossed agencies. So looking at the statewide system and how we can improve child welfare and juvenile justice. So those are the types of things we've spent the funds on.
And the enterprise funds, these cross-agency, does that come out of your statute from 2008, or when does that statutory duty come from?
Yes, ma'am, it does come from our statute in 2008, but that's actually taken from our prior statutes as well, from the Children and Youth Coordinating Council.
I'm just asking myself right now whether that would enable you or authorize you not to follow the mandates of the statutory Children's Trust Fund, and I'm confusing myself as to how you could do that. Mm-hmm. Do you have an explanation about how you can change the purpose of one to accomplish the purpose of another?
Well, we were utilizing the funds consistently with our mission as an agency and our statutory obligations as an agency, and so that's what we were trying to be consistent with that.
Okay, I'm going to look at that myself because I'm interested in whether the Children's Trust Fund designated fund has been used for its statutory constitutional purpose of prevention of child abuse. And if you've got $9 million left over, you've been lapsing, and you're not spending it on that purpose, that concerns me.
Sure, absolutely. I'd be happy to look at that with you.
Could you give me an example of enterprise? I'm not familiar
Sure.
with enterprise.
That's just a term that we often use for things that are kind of a state perspective, cross agencies. So a great example of that is the Georgia Children's Cabinet. It's actually chaired by Mrs. Deal, and it was chaired previously by Mrs. Perdue. And it's a collaborative body of all of the state child serving agencies and the juvenile courts. And the group comes together to look at how collectively we can improve child welfare and juvenile justice.
And how much do you spend on that?
We don't spend administrative funds, but whenever the cabinet has a project that they are seeking to be involved in, then that's what we spend the funds on.
For an example.
Sure.
We'll
Of what the Children's Trust Fund money, whether you're calling it enterprise or whether you're calling it grants, what that is paid for.
Absolutely. Absolutely. We can get that for you.
Well, you know, one other thing I don't understand when we're in such a budget crisis, we spent the state money instead of the money we had in this thing to
That's also state money in the Treasury as well.
How did that state money get there? Do you still have that fine that's on divorce records and the filing fees? Is that the way it got there? How did you say state money? You think about state money as being appropriated. Was that appropriated money, or did you collect it through fines?
My understanding is that we, at least in recent history, have not collected that by any fines. And it's been funds that were appropriated to the Children's Trust Fund or now the Governor's Office for
So
Children.
are we still collecting that fines from divorce settlements?
I'm not sure. If we are, it's being appropriated or assigned to a different agency, but not ours.
So how are you accumulating all this money?
The balance is actually much right.
I have a list of your grants here, and I can't tell. Some of them say child advocacy, or I guess CA. That's what that is. I'm not sure what DL is. I guess that's the best. I don't know what that is. CS, CC, DJ, JO, SE. ST.
And we'd be happy to spell that out. I believe we actually submitted that to your office too. Sure. I think you referenced CC, which is Caring Communities. It's one of our grant programs. It encourages communities to implement what we call a system of care in their community, to look at what the needs are in their community and to develop a collaborative body that helps to implement those dollars and those resources in response.
How many counties do you have covering systems of care? I thought
we have 22.
22 systems of care. And how many do you plan to just keep it in 22 counties?
Typically, what we've been doing with the system of care grants, I'll just say it that way, the system of care grants, you're eligible to apply, and then you're eligible for up to 2 years of continued funding for a total of 3 potential years of funding. And so some are about to finish their 3rd year, some have just started. So that number will fluctuate a little bit as some come on and some end their grant cycle.
Another question I have, this Embrace contract.
Yes, ma'am.
All right. In the 2011 budget, we funded state funds of $175,000 over to DFACS. Did they in turn that money over to you?
No, ma'am. Those funds, from what I understand,
I just saw on your explanation of Embrace contract.
Right.
I couldn't, the $173,000. Did that come from? And did you have anything to do with Embrace contract in your department?
We did. Just to kind of give you a perspective, the money you just referenced that was in the budget from, I think it was under DFACS's budget.
Child welfare.
Right. that money was utilized for some of the existing communities that were implementing Embrace. For those of you that aren't as familiar with Embrace, it's essentially a program that that develops a system in local communities for connecting the child welfare system, DFACS, with foster parents. So we have a neutral, independent liaison, we call a foster parent liaison in the community, who helps to build relationships between the foster parents and DFACS. Gives them someone that they can call, at 2 o'clock in the morning when they can't get their caseworker and they have a question. Helps them with connecting them to resources and connecting them with DFACS as well. I'm sorry?
Kids are part of the foster care system.
Right. Right.
So they have to report to their caseworker.
Oh, of course. It's not really for reporting purposes. If they have a question about whatever it may be, a question about medical services or how you connect to something, a lot of foster parents, especially newer foster parents, do have a lot of questions and oftentimes like to talk with another person who's been a foster parent before to talk through some of the issues or challenges that they may be facing. And so we've seen that it has significantly increased our retention rate of foster parents to have this person, this neutral person in the community that works to build relationships and bring the foster parents and DFACS together. So that's a brief overview of kind of what it is. But to address your question, the DFACS funding was being utilized for the existing communities that were implementing Embrace. And so we, in working with Embrace and working with DFACS, wanted to look at how we could expand that model with more of a regional approach. So how we could utilize a foster parent liaison for a region so it was more replicable and easier to expand and sustain. And so that was what this funding was utilized for. It was utilized for looking at how we could expand the foster parent liaisons in the Embrace program, but then also to expand some of the trainings of foster parents.
Well, this
is critical.
The total funding for Embrace was $495,000 of state funds.
Perhaps within DFACS. Within our office, it was only about $125,000, their last contract.
I've got 173.
Okay. That may be what
so
it was.
if we got 173 for yours in state funds, and I have 173 from DFACS, if you add those two together, it comes out to about 370-something thousand.
Sure.
Okay. Representative Oliver.
Last year, when we looked at the Embrace contract, this committee eliminated the funding that was going to Carl Vinson. And that funding was reinstated by TANF, or was it reinstated by you?
By TANF, was my understanding,
so,
in the DFACS budget.
So for the Embrace contract, are they still getting TANF money at Carl Vinson?
Yes, ma'am, I believe so.
And they're getting $173,000 to you.
Correct.
And 173 from the state that the Senate put back in.
And are they getting an additional...
And 300 more right there.
Are they getting additional funds other than the Carl Vinson money and your $173,000, as far as you know?
As far as I know, for the Embrace program, no, ma'am.
Are any of those funds used to supplement any salaries in your agency?
No, ma'am, they're not. All of those funds are the grant to Carl Vinson for the trainings and for the foster parent liaisons, et cetera.
Are any of the salaries of anybody in your agency supplemented in any way by any of the contracts?
The Embrace, no, ma'am, not at all.
Any contract?
No, not only by federal funds, but not any contracts.
So are some of the salaries in your agency supplemented by some other source other than state funds?
Yes, ma'am. We utilize a lot of our federal funds for salaries. We have, for example, 2 grants from HHS. We have 4 from OJJDP, the Office of Juvenile Justice Delinquency Prevention. So we try to really maximize the use of our federal funds for administrative
But my
purposes.
question is, if state fund, if I'm told on a piece of paper that the state fund sets a salary at $90,000, there may be an additional fund on top of that salary from some federal funds.
Oh, no, the salaries that we've indicated to you, that's their total salary, all funds combined.
I get two different things from the governor's office on you. One thing I got from the governor's office, it said your salary was $95,000 a year, and then I got another thing, both of them on governor's things,
Sure.
of 67.
It is actually 67 and then change. I think the 90 may be including benefits.
Benefits.
You have to include for every state employee, you have to include about 40% of their salary as benefits. So my assumption is probably that's where that figure came from.
Okay, I didn't know. I got two things on government things with two different
Sure.
things. And do you get any other salaries from any other state agency?
No, ma'am. That's my total salary.
Okay, so we could. All right. I just couldn't see the difference in the two.
And I'm not sure.
The next thing, when you figure up your expenses and the percentage of admin, are you including this money that you're getting for grants in as your administrative fee? And
I'm not sure.
Okay. So
Do you
you're
mean-
getting so much for grants.
Federal, you
Federal,
mean, right?
okay, federal funds. How much do you get in federal funds for administration?
I'm not sure what the administrative breakout is, what the percentage is, but when we say that our administrative budget is 4.9% of our total budget, that is state funds and federal funds, if that answers your question. When we calculate that our administrative
I just want to know how much
percentage,
state funds you get in administration.
total state funds administration.
We don't break our budget out.
Well, we could, I think we do. We could have that. We'll get you that figure.
I thought you well, what's your total expense on administration?
It's 4.9% of our total budget.
The money. How much
The actual
money?
dollars. Do you know what the dollars are?
You know how much your dollars spent on administration?
I just have the percentage on me now.
No.
I could calculate it. It would be well, we can calculate that and get that to you.
I've got a guesstimate here of 1.2 million.
Well, 1.2 million is for the. I think she broke
We'll
down.
get you that figure. I'm sorry, I don't have that on me, but we'll get you that figure.
I think you broke down the admin cost of. Okay.
I've got it on some of these papers.
Sure.
Okay.
And if you'd like, I can go ahead and, while you're looking at that, go ahead and talk to you about the back to the tracking sheet and share about the reductions, and then go ahead and cover that if you'd like, if that's of interest.
Have you gotten anything from the Office of Accounting about the way you might have placed money? You got any reports from the Office of Accounting? The Accounting
Office of Accounting on our report. I'm not sure. No, ma'am.
About reflecting lapse funding. Have you got anything from the Office of Accounting about reflecting lapse funding? You've received no notice from the Office of Accounting in the past how long have you been with the agency?
Just over a year.
Okay, but before you've never gotten any.
No, I've never seen something concerning lapse funding.
From the Office of Accounting. No. Have you ever seen anything from the Office of Accounting about lapse funding?
I'm not sure what you would be referring to. I'm sorry.
The Office of Accounting, you know how they review your available funds and expenditures, don't they do? The Office of Accounting looked over your available funds and expenditures at the end of the year.
Is this the audit that was just recently performed, or?
I haven't seen an audit. Did you just have an audit done by the audit department?
By the state, yes.
State auditing department just did an audit. When did that audit come out?
It's about less than a month ago.
We haven't received copies of it. Could you get us a copy of that, please?
Sure. We're actually part of OPB's audit. So I don't know if you've seen that.
But this was
because we're administratively attached to OPB.
I think the question is that we believe that lapsed money has to go back to the state. Okay. And we're being told that, and you confirmed, that $9 million you've not returned to the state. And we believe that there are budget requirements that you have to get written permission not to lapse the money.
Okay.
And
okay.
We're holding $9 million, but there's no written authorization for that. Am I correct?
The way that the trust fund was originally set up was to be administered in that fashion. So there actually were more funds in there prior to when we came in, but then in looking and speaking to the other state child serving agencies and the governor's office and OPB, we did begin to utilize those funds for different programs.
And that's where I'm mystified, because I was the author of that bill. So I remember a few things about it.
Sure.
Designated fund, constitutional amendment, specified statutory authority on child prevention. And now it's merged and it's lapsed and it's, so I'm
well, I'd be happy to look at that with you, certainly.
Was this done by a constitutional amendment?
Because there's a designated fund.
Can
So
you
I don't know
just
how
do
you
that?
change a designated fund. You can't change a designated fund over to general funds. That's
Sure.
my mystery. But I'll
Right. Well, and this was the 2008 merger of the two agencies was what resulted in the Children's Trust Fund being part of the Governor's Office for Children and Families.
I agree with that, with its own governing authority.
Sure.
But I don't agree that you can change a constitutionally created separate fund into general funds and ignore audit lapses. That's what I'm confused.
Well, and the way that our legislation is written, it actually does put this Treasury account under the Governor's Office for Children and Families. So,
separate account, though. That's where I'm
Right.
confused.
Okay. Well, perhaps
The
we can.
rules and regs on that thing, which asked that question about the administrator.
Go ahead.
You have submitted some rules and regulations. Who drafted those for you, please?
It was Lydell did this primarily, but what we did, we looked at other state agencies that were similarly configured, primarily the Criminal Justice Coordinating Council, and had developed this draft. We had actually never had administrative rules to be able to more publicly share our policies. Our policies and procedures, our general policies and procedures, and so we felt like it was important to develop some administrative rules to.
So, Mr. Samples, you drafted this? Yes. Okay. And you used some samples of other agencies, or did you hire a lawyer to help you, or are you a lawyer?
Use some other agencies to help draft.
And we also reviewed it with our advisory board, and we do have several attorneys on there as well, and they reviewed it.
And what is your understanding of the General Assembly's procedural opportunity to object to any of these rules or regs?
Do you remember that?
It went through the process for, it was reported to all of the Legislative Council and went through all of the process for that.
Has that process been completed?
Yes.
I don't think it has been completed. I think if you look at the statute in paragraph E and F, you'll find out that we have 30 days, 50-13-4. Let's look at this together later. I think the General Assembly has 30 days from the beginning of the session. That's 30 legislative days to object. And if you're telling me you're moving Children's Trust Fund out of constitutional amended separate funds into general funds, and that might be something that the General Assembly might object to. So the process is not complete. Yes or no?
It followed I had the understanding that it followed the guideline that in the flow chart that was provided, I believe, to you as well. So it did go through all of the necessary steps. Everyone was alerted according to the rules and regulations. So we believed it to have been, the process to have been complete.
Okay.
And if I may, just in addition to that, the question that you have raised about the Children's Trust Fund being under our office was actually not as much addressed in the administrative rules because it was addressed in the 2008 statute that created our agency. This was more of our, again, as it stated, the administrative processes of the agency and our governance.
Representative Manning.
Just one quick add to that. I received a letter back in June that asked my Committee of Children and Youth to look.
We can't hear you.
Sorry. Asked me to look into it, and I contacted Sue Brumby and the legislative office, and he said that since the session was not in view, it was no need to call a special meeting of the committee. I could just do it when we came into town beginning January. And since then, I've gotten the lady from the Legislative Council, I think, to contact Mr. Samples. And he had provided me with some information, and I'm in the process of doing an ad hoc committee to look into the rules and regs as per the statute. So I just wanted to let you know that.
Representative Henson.
Thank you. I think I'm just going back to the concept of dedicated funding, which is very hard and very rare in state government. But to me, dedicated be like taking DOT dollars and putting them into education. And they're dedicated. And I mean, if your funds passed constitutional amendments and said they're dedicated, they're dedicated. And what I'm hearing you say is they're being used for other purposes, and you've substituted funding, and I'm very confused about that. Because I'm under the impression that constitutional amendments mean it's passed. I mean, we don't have the discretion of what to do with it. We're being told what to do with it. And I'm just wondering how you're having the discretion as opposed to being told.
Sure. And I guess I would just respond in saying that we are utilizing the funds in a way that is consistent with our enabling legislation. And so because the Children's Trust Fund is now part of the Governor's Office for Children and Families, we're looking at our enabling legislation as a guide for how we utilize the resources.
But is that conforming to what the citizens of Georgia said it should be used for? And that's the big question.
Sure, absolutely. And I guess I would respond to say that yes, the funds are being utilized consistent with the legislation and what was required by us in that.
Run that one by me again now. I didn't understand that answer.
It's just again that the our enabling legislation provides us a guide for how we utilize our resources, and our enabling legislation allows us to do really all the things that we do, everything from child abuse and neglect prevention through youth development and juvenile justice and family violence. And so the funds that we utilize must be consistent with those focus areas.
So that your enabling legislation takes precedence over a Constitution amendment?
From my understanding, at least, because the enabling legislation was after the legislation that created the Children's Trust Fund, and the enabling legislation allowed for us to administer this Treasury account and then therefore administer it consistent with our enabling legislation.
Treasury account, that's the first time I think I've heard you say that.
That's what y'all have called the Children's Trust Fund.
Okay.
The Children's Trust Fund was actually an agency, but the Treasury account, or however you want to call it, is this fund that we're talking about.
Can I ask Representative Oliver a question? Representative Oliver, does that money, when you get a divorce and they tack on a $5 fee, does that still happen? I hadn't gotten a divorce lately, so I don't. My last divorce was a while back. So I had to pay that $5. I'm still getting funds, but not
15677-4. Yes, it's statutory additional fees on divorce filings that clerks of the courts collect and then put into a designated funds. And then I can't remember the others, whether it's birth certificates or death certificates, but there was a series of other fees. And I'll do that research, and I'll go back and refresh my memory on all that.
I'm happy to meet with any of you to
Thank
talk
you.
about it.
Representative Hurd.
Just be very brief about this. You can see there's a lot of concern about this. Have you gotten any advice from legal counsel on this?
This has been, when we created the enabling legislation in 2008, we did have advice that this would be consistent with that moving the trust fund under the Governor's Office for Children and Families would be consistent legislatively.
We're not. I don't object to that. That's not what I object to.
That's not my question either. It's the use of these funds, though. That's my question. And have you gotten a legal opinion about the use of these funds?
Yeah, in 2008, when we created the agency, that was how we were instructed to continue to administer the funds.
Could you give us that written legal opinion? We'd like a copy of it.
I'm not sure if I have a written legal opinion.
So
that, but
you hadn't gotten a written.
It was in consultation with with general counsel, not legislative.
So they never wrote anything saying that you could use the money like this. You never had a legal opinion.
I believe that their interpretation was just that by including it in the enabling legislation that would suffice.
But that wasn't in writing, though, to you.
I'll look in my records, but I don't believe we had a written documentation of every discussion of that.
Okay.
Does your enabling legislation mention your statutory duty you would have towards family violence?
It references a number of different program areas, but leaves it very broad. Yes, ma'am.
Does it specifically say you have a statutory duty for family violence?
It allows us to do that for programs serving children and families, and I can get you that exact.
Does it use the term family violence?
I'll have to go back and check about the actual language. We pulled it from the prior agency, so okay. I'll verify that for you.
May I go to another subject matter?
Yes, go ahead.
We have gotten a lot of information that's inconsistent about the governance of Family Connection and the governance of your agency.
Okay.
Your board is an advisory board, not a governing board. Is that correct?
Yes, ma'am.
You're a state agency.
Correct.
Family Connections is a nonprofit corporation. Is that correct?
Correct.
They have a governing board. Is that correct? And you were on that board.
Yes, ma'am. As an ex officio member. Yes, ma'am.
I can't see how you administer another nonprofit corporation's independent private governing board as a matter of law.
The way that it would be structured, right now there's, and you all know this, technically the funds currently appropriated to DHS, to Family Connection, is actually to a state agency. That doesn't really exist, but it's to a state agency, and then the state agency actually appropriates those dollars to, or grants those dollars, however you want to say it, appropriates them to the nonprofit entity, Georgia Family Connection Partnership, Inc. And so we would propose to create really a very similar financial structure whereby we would have almost as a sub-program within our budget Family Connection. So we would still maintain the nonprofit status and then maintain the board for the governance of those programs.
What percentage of Family Connection Partnership is private funds?
88% of their funds are from the state, so that's a mix of state and federal. And then the other 12% is private funds.
Okay. They suggest a figure that's closer to 20%.
Okay. In their 09 budget, or in their 09 annual budget report, that was the figure that they actually gave, was 88%, and then 12%.
What percentage of their money is used for administrative costs?
18.2%.
And they testify that their administrative cost is 6.3%. And I believe the difference relates to this technical support money. Am I correct about that, how you interpret that?
It may.
Well, what is your analysis, what is your argument that the technical support services out in the state are in fact administrative state costs?
What we would propose to do is to really look at, we do believe that...
I'm happy for you to give me your plan,
Sure.
but can you answer my question?
Sure.
What is your argument that the technical support appropriations for people in the field is administrative funds?
Right. We also believe that technical assistance and training is critical to ensuring success in the local communities. But what we believe, though, that we want to maximize those dollars that go to the local communities and then hear from the local communities what they want in terms of training and technical assistance. And so we would look to streamline some of that state-level administrative or technical assistance funds in order to maximize the resources that go to the local communities.
You appreciate the fact that I don't think you answered my question.
Oh, I'm sorry. I thought.
Why is that technical support service in your analysis an administrative cost as opposed to a service cost? Is that the difference in y'all's analysis of administrative costs?
I would not say so. In our analysis, do you mean of our budget or the Family Connections budget?
They say their administrative cost is 6.3. You say it's 18 point something.
Oh, so the difference.
The difference is technical support. I'm trying to figure out
Sure.
how you're arguing that that's administrative support.
I believe that the difference in those percentages would be those that work in the state office versus those that work in local communities but on behalf of the state office. And so what we would we believe also that technical assistance is critical. And when I say we have 4.9% of our funding as an administrative budget, that's our administration, but that's also those that provide technical assistance to those that receive grants. And so we see that as
But you only work in how many counties, did you say? Continuous care.
Oh, we have over 200 grants that we give to communities. The 22, those were just the system of care grants. But we give a number of grants.
How much local money does your agency pull in?
In local communities? Well, if we're just talking about the system of care ones, in the first year they have to pull in from their local communities or whatever private funds, they have to pull in in the second year, they have to pull in 25% match, and then in the third year, 50% match. They have significant both cash and in-kind private resources, and that's something we work with them.
How much have they pulled in? Give me the figure. Not the percentage. I want money instead of percentage things. If you could do it in dollar amounts instead of all the percentages, because I don't know if it's a percentage of what.
Sure. Well, we can get the total. And that's across a lot of our grant
So would you have
programs.
technical assistance if you took over? Family Connection, would you have this technical assistance out in the?
Oh yes, ma'am.
Would you count that as part of your administration fee, or would you add that in administration fee, or?
We would consider that administration.
So
what we're proposing is to reduce the state level administrative expenses, that being both those that actually work on Peachtree Street, but then also in the local communities. And
well, is the salary for the how is the salary paid for the director of Family Connection? Is that state money?
For the executive director of Family Connection, I'm not sure what her funding sources are. My suspicion would be that it would be certainly some state and some federal, but I'm not exactly sure how her funding's broken down.
Sort of on this thing, I guess you printed this out that sort of indicated it was state, but our research says it's privately funded.
That I'm not sure how she's paid. Yeah.
Okay. Because I just assumed when you compared your salaries that it was that.
And that was actually not my document, so I'm not really sure exactly what you're looking at. The one that I passed out was the front and the back.
You didn't do any of this document?
That's not my document, no ma'am. I passed out the one that's just the front and the back.
Is this your document?
Yes, the one that Representative Oliver has is the one that I passed out. Yes,
Is
ma'am.
it your document?
It was actually produced by the governor's office.
Whose document is this then?
Yeah,
That's what she said.
it says Office of the Governor.
That would also be by the governor's office. I'm not sure where that came from, though.
That's where you were attached.
We're administratively attached to OPB.
But you didn't have anything to do with any of this.
So you didn't have anything to do with any of these papers that were given out?
The double-sided one that I passed out was the one that I shared with you. I was just referencing on the one that I think you're talking about. I don't have that figure. I think you're referencing salary, which is not something I have a figure for.
Then in that case, I guess I need one of your two-sided ones.
Okay.
is what we're talking about.
Yeah, that's the correct one.
Okay. I know that.
Have you at any time carried over any state funds?
I'm sorry, what was your
Have
question?
you at any time, has the Governor's Office of Children and Family carried over any funds that were not Children's Trust Fund?
Carried over.
From one year to the next? Lapse.
Lapse. We really strive to not lapse any funds, state or federal funds, and so we generally keep that below 0.05% of our budget. So we really lapse very few funds.
You say you lapsed $9 million, according to the
That's the money that has historically been in our Treasury account. So it's been there for 20 years or so. That's why that funding is there.
When Susan was children, Susan Phillips didn't have that much money.
Respectfully, yes, ma'am. There was, when I came in, there was about $10 million or just shy of $10 million in that account when I became director. In
Why do we keep that money in our account when we're having such a hard time financially in the state for children? I mean,
well, we do utilize those again on those enterprise projects. So, sure, absolutely. And if any of you have if you want to discuss any ways that you would like to see some of those utilized, we certainly would be interested in discussing that.
Well, I'd like them utilized the way the statute collected the funds for.
Thank you.
Representative Henson.
Just remembering from previous years, and I'm sorry I must have missed one of the meetings this year, foster parents have always talked about how little money they receive per diem. They talk about how little money they receive for clothing for the children. We're sitting with $9 million that could be going to these children that are in foster care. Is that in compliance with the statute? With the constitutional amendment, would that be in compliance with it? Or if that money was used in compliance, then we'd have other monies that would be able to be used to help these foster parents with additional monies that for so many years that I've been down here that I've always heard that they've needed. So, I just don't see why we're keeping money in a treasury at a time that people need it so very, very badly.
Are there any more questions? Anybody else? Any more questions? Representative Oliver.
I think you understand that we in very different ways have a respect for the way the 159 counties have developed their own history around collaborations, local collaborations. We have a hard time figuring out how you're going to duplicate that from your oversight, your administrative oversight, in absorbing family connections, and that's making us very nervous.
Sure. We also certainly respect the work that the local communities have done and value the role that collaboratives play in local communities. And that's why we do want to preserve it, actually, at a time when Family Connection is having to look at the reductions that they may face. We put together a proposal that would actually offset that 8% reduction that local communities would face. So they would get about by cutting some of the administrative expenses, we would be able to offset the FY12 8% reduction. So every local community would get about $3,800 additionally. We also see Governor Deal sees great opportunity with us to be able to pair the infrastructure collaborative role that Family Connections plays with the grant resources that we have, so we can truly build capacity in communities by not only encouraging that collaborative development, but also helping communities when they do see a need by giving them some dollars to actually support that direct service development.
Representative Manning.
I ask for a list of your grants, which I appreciate very much, but I would like, if I could, to get some more detail about how you administer these funds, when they're awarded, when they expire, what kind of measures you're using? Is there a matrix that you use in order to see how they are performing and when those are evaluated, and how you administer these $23 million worth of grants?
Sure, absolutely. And just at a very high level, across the board, they're primarily quarterly reporting, some based on the interest or the needs of the local, of the grantee. We do monthly reporting so that they can get funds more quickly. But primarily it's quarterly reporting, so they submit to us a program and a financial report of what they've been doing in that last quarter, and it does include outcome measures. And then they do a final annual report that includes much more detail. We also have an agency-wide, what we call a strategic framework that has our priority areas: educated, healthy, safe, and growing, and then the different age groups that we work with. And within each of those different categories, we have certain outcome indicators that we track. So, for example, 0 to 5 educated might be ensuring school readiness and looking at very primary prevention programs. And we have specific.
So you're doing child readiness. What's right from the start doing?
We do very primary child abuse and neglect prevention, which does then in effect ensure school readiness. So when you help to prepare, one program, for example, is called Parents as Teachers, which works with parents in helping to develop some of those parenting skills. And it's a very primary child abuse and neglect prevention, but there are also outcomes that improve school readiness as well.
I'm sorry. Go, Representative Hurd.
I pass. Thank you.
Representative Henson. I'm sorry, Murphy.
No problem. If you are successful in bringing Family Connection under your department, do you see changing the formula in which each of these connections?
No, sir. We do not plan on changing the formula at all. We still plan to administer a grant to every local collaborative, and would just look to see how we could help them leverage additional resources. But we would not seek to change that formula at all.
Well, you know, this has been around for about 20 years. What makes you think you can do it in 6 months where it's taken them 20 years? You're just going to go on the infrastructure.
Well, we wouldn't propose to change what the local collaboratives do. We would propose...
Locally, do you know how much money they pull in? Can you tell me?
Each of the local collaboratives?
Total.
I'm not sure.
Okay.
I'm not sure. It would probably be similar to a lot of the grant programs that we work with, and how much they
Would you be surprised they leveraged a lot more than you did?
Pardon?
Would you be surprised if they leveraged more money than you did?
Well, it would certainly just depend. And it would depend on, the cash leverage, the in-kind leverage, but our grantees really do a tremendous job of leveraging funds in their local communities for their programs. So we would hope to just continue to expand that.
Well, and you did you take over the funding of the family violence shelters?
We are administering that.
Where's the money? Where does the money stay? Does it stay in the Governor's Office of Children and Family, or is it still in DFACS?
For the 11 budget, it's actually it's within DFACS or DHS, and then we administer that. We do all of the site visits. We do all.
But the money actually stays with DFACS.
Yes, ma'am. For this year.
Did we reduce the amount of administrative costs over in DFACS? By y'all doing
by
all
us,
this?
They did reduce positions.
How many positions did they let go?
They did not let them go. They had some open positions within child welfare, from my understanding. So they reassigned their work so that they could do child welfare programs.
Representative Oliver.
That's my last question, I promise.
Oh, you can ask all you want to.
As a member of the Family Connection Board and your ex officio responsibility with your fiduciary duty to them, did you tell them before your governor's budget came out to absorb their entire program?
Yes, ma'am. I did contact the director prior to the budget coming out.
Okay.
Representative Henson.
With regard to shelters, are we still going to have an adequate number? Are we going to have the same number that we currently have?
Oh, yes, ma'am. We've not changed the number of shelters that have been funded, shelters or centers, domestic violence and sexual assault. We've not changed their funding structure at all, really. We've just looked at how we can provide greater technical assistance to them under our office.
So, Evie, you're telling me going into 12, we're going to have an adequate number?
The current shelters and centers, there's no proposal to have any changes in those that are currently being funded.
So, okay, I'm going to follow up later because I know that we'll be talking to you further. Okay, thank you.
A question?
I'm fine.
All right, thank you. Any other questions? Thank you, and thank you so much for coming. Let me ask you something. Do you have to do these federal reports that you have to send out on federal grants?
Any of the reports that we have to send?
Do you have a final wrap-up that you get from the feds when you do a grant? Can I have a copy of all those federal reports? That
We submit a report.
Okay, and they don't submit something back to you?
They'll often send a letter just saying thank you for your report.
But they never say whether you okay. All right. Okay. All right. Thank you. What are CB cap funds?
That's a federal grant. It's community-based child abuse prevention.
Did we maximize all the money in that grant this year? All the money we could pull down from the federal government for child abuse this year?
Yes, ma'am.
It was all maximized, every cent that we could pull down.
We look at all the state funds. Every state receives what they call a population-based formula percentage. So based on your population, a variety of.
Could you tell me how much we received? And I've got something from the feds. And so you're telling me we maximized every cent we could get from the federal government in federally funded child abuse money?
Oh, yes, ma'am, absolutely.
Okay. And get me the amount you got, because I'm getting a different report from the... how much is it?
It's about 1.1.
1.1, and that's the most we could get. Okay? Thanks.